us and contributing. I hope it will be an interactive session. Please have tea as we start the session so that we can reduce on the movement. So if you need to have coffee, it's outside there and some snacks. The washroom, it's downstairs, the second pillar on your right. So in case you need to use the bathrooms, second pillar on your right. Welcome so much to Kenya, and let's enjoy the session.
Good morning, everybody. It's good to have you all here with us this morning. I think it's a beautiful day. Um, I just came from Joburg, where the weather hasn't quite decided whether it wants to be sunny or whether it wants to rain. I think in the morning the sun comes out, and then everyone gets excited, and then by late afternoon it starts raining. So I have to say, what a beautiful day it is in Nairobi. And for myself and my team, and all the guests we've brought from Nigeria, I think one thing I always appreciate and love about coming to Nairobi is the warm, the one mentality. So I think in a way, I think we're going to take Nairobi as our second home, because every time we come here, we have such a wonderful, wonderful welcome. So we're really excited to be here this morning, and also to have all of you in person. I know initially when we reached out to everybody, some people couldn't join in person and some people could join online. So we're quite pleased that all of you have joined us here in person. We have a few people who are joining us online. We know how towards the end of, I'm sure it's the same in Nairobi, everybody wants to pack all our programs in, because we know once it comes to December, you know how when we work with funders, you have to use up all your funding, but apart from that, is when you realize that you've come to the end of the year and you want to make sure you get all the projects in. So I know that this month is asking a lot, and there are a lot of global events happening at the same time. So for those who have been able to make it here today and those who are online, we really appreciate you being here with us this morning. So I'll introduce myself. My name is Vivian Ehekwazu. I am the Managing Director of Nigeria Health Watch. I'm here with my team members, Chris Bassi and Kenneth Ibe, who are the social media managers. And we're really pleased to be organizing this with Mercy. I remember we were racing through the streets of New York and talking about this during the UN General Assembly meetings, and we were conceptualizing, saying we have to do this, no matter what. By the end of this year, we have to just somehow put. For myself and my team, it's been a pleasure working with Willow Health Media in putting together this roundtable. And I think it's all of us in this room. We understand the reasons for having this meeting. I think for all of us, we're conscious of how the year started. We all had our plans come January 2020. That was suddenly usurped by government policies that affected our land. That I think we were aware that as a continent, health has been a challenge, and there are many avenues we can use to address that. And one of the issues, or one of the areas that's been spoken about quite frequently, is the use of health taxes so today, we're here to talk about how can we think about innovative financing and really unlock domestic resources for health through the use of health taxes. As I just came back from Joburg, and as all of you are also aware, there was the big global fund replenishment. So on Friday, a lot of anxiety. 11.34 billion was raised, slightly less than the 18 billion that was anticipated, but still some countries haven't fully pledged how much they would give. But I think underlying that is the realization that the real politic and the reality is, with governments globally facing internal challenges, ODA funding is shrinking. And we know as a continent that we face multiple health burdens, and we need to find ways of financing our health sector using other methods than what we've been doing with our dependency on ODA to date. And why did we come all the way to Nairobi to have this discussion? We could have just stayed in Nigeria or just had this discussion in Kenya, or done it virtually. But we felt it important because this is not just a Nigeria-specific discussion or a Kenya-specific discussion. This is a continent-wide discussion. We've talked about, there are many other ongoing parallel conversations about how do we as a continent reform the global health architecture? How do we as African countries lead in the decision making for our own health sector, given that, with fiscal pressures and changing disease patterns and shrinking aid flows and the movement of health workers, this affects all of us in East, West, South, North Africa. So this cross-border conversation is essential because the solutions we will explore and discuss, yes, are not specifically country-specific, but I think we can learn a lot from each other. And across the continent, the reality is we are facing very similar challenges. So we must find ways to, sustain our own health systems, especially now, as mentioned, we have we have a growing burden of preventable diseases. And so, this roundtable, I think, today matters because we're meeting at a point where we cannot just rely on external funding. We're dealing with many chronic conditions. Non-communicable diseases are rising, and these are not areas that are typically donor-funded, nor should they be. It really speaks to also how do we relook and reform our health sectors to address many of these NCDs. And we must really look inwards. How do we adopt sort of these fiscal strategies that allow us to protect our own populations? And the options are many. And around the world, we have actually seen examples where countries have implemented very well-structured tax policies on goods such as tobacco, alcohol, and sugary drinks. And these things can happen because invariably these, unhealthier, should I put it this way, consumption habits have a repercussion on our population. So when we look at the use of tobacco and alcohol, how can we come up with systems and innovative ways of, taxing and making sure that tax is now used for the health sector? So we've looked at how governments have to look at creating some of these other alternative funding streams and really using the evidence more than anything to back up a lot of these assertions. Because if certain products are driving preventable diseases, it's only fair that the revenue generated from them is channeled back into the population's health. And we see good signs of progress in this area. We hear today about we'll hear today about some success stories. In Nigeria, we're also starting to see some promising steps. Recently, the Senate advanced an amendment to the Customs and Excise Act, and the proposal is to make sure that they direct taxes on non-alcoholic drinks and sweetened beverages towards some of our health programs. So this bill that's now come for a second reading, the idea is to find ways to make sure that the funds are earmarked for the health sector, and this is often the difficult part. So whilst we may raise the taxes or earmark or have the taxes from the excise duties raised, the question now is where do those taxes actually get directed? And that's actually more complex than it seems. So I think the fact that this bill has passed second reading in Nigeria, I think is definitely welcome news. And throughout today, we will hear other examples of what other countries are doing. So what do we really hope to achieve today? Because, in as much as we're bringing all of you together in person and online, what do we ultimately hope to achieve from all these discussions in this roundtable? So, the couple of things we want to talk about. So we want to look at what's working in countries that have implemented health taxes, some of those practical, real-life examples, not just thinking about the theoretical, but what actually has worked. How can we build stronger coalitions across countries, given we know that when we talk about health taxes, there are very strong industry bodies that are already finding very creative ways of pushing against it. How can we ensure that there's governance and accountability for the revenue raised? Instinctively, we know as citizens, nobody likes to pay taxes. So there's also that need to create confidence that if people are if we're going to say we're going to tax, sugar-sweetened beverages or tobacco, alcohol, how do people know with certainty that those funds will be earmarked and ultimately benefit them? So, this session we hope today will be interactive. As you saw with your programs, we'll have a couple of case studies presented. There'll be a moderated panel discussion moderated by Dr. Mercy. And then there'll be 2 interactive discussions that look at specific areas that we really want to explore and really look carefully at. And we really want to hear your candid conversations. We're not applying Chatham House rules to these discussions, as you know, it's online. We think it should be an open discussion as much as possible. And we hope we have our online participants also feed into the discussion. So we haven't done a round robin of asking everyone to introduce themselves specifically just for the sake of time. But we do hope that if you answer a question, the way the interactive discussions will be run will specifically start by directing them at specific people. And thereafter, other people are welcome to also share your own perspective. And in doing so, when you do speak, it would be good to introduce yourselves. We have the name cards around the table, but just so that we all get to know each other better, that would be really great. So we also hope that this is also an opportunity for networking. I know that I travel quite a bit, so I've met some of the other people in this room in previous meetings, and I think that's the whole idea. I think as countries, as a continent as a whole, we are really stronger when we work together across borders and not just look inwardly and solving our own problems, but how can we reach a hand across and actually speak to other people from other countries who are facing similar challenges? Because I think it's only through us working together as a continent, as a region, that we really, really learn from one another and become much stronger and actually share best practices so that we ultimately, we can deliver whatever mandate we're responsible for. So once again, on behalf of myself and my team, and just thanking the Willow Health team once again, I welcome you all to this roundtable, and thank you very much. I'll hand over to Mercy.
Thank you, Vivian. Let's give a warmer round of applause. The sun is out, it's a warm day, it's a nice day. Thank you very much, Vivian, for your welcoming remarks. I'll not take so much time because I'll be back here with a panel, but thank you so much for making the time to be here physically. I know after COVID, we have been used to doing everything online, 1 hour, 2 hours, we are done. But we thought if we are here physically, there are things that you can learn when you network, when you get to know people. There are certain other things that you'll pick from this conversation that you may not pick online. And it's good to network, and especially from the team that has come in all the way from Nigeria, we appreciate and we look forward to a very fruitful and engaging conversation. So next I want to call in our keynote. I want to call in Edwin for a keynote address for this particular conversation. Edwin is the Global Managing Partner with AXM. He has over 20 years experience leading large-scale donor-funded health systems, transforming programs across Africa. Edwin and I met. I think this roundtable is really a fruit of the sidelines of the UN General Assembly. We met on a plane, it was delayed, and we had conversations, and we realized we are all interested in the same things, and we thought we should have this conversation. We should have a conversation around, what alternatives are there, and there are keywords that are popping up even as the discussions happen. There's a changing landscape, domestic resource mobilization, to earmark, to ring fence, taxes. So all of these things, what does it mean to our African continent? What does it mean to the people in the room? So Edwin, karibu sana. Let's appreciate him.
Thank you, Mercy. Good morning, everybody. Good morning, everybody. Slightly better. Hello, Nelly. Habari yako? Welcome. My name is Edwin Masharia. As you can see, I sometimes wear what look like suits, but usually I prefer jeans and jackets. It's a great pleasure to be here with all of you on what I think is a really, really important conversation. I will not bother introducing myself. The only thing I'll mention is there's a zero that's missing at the end of here. It actually should be about 2 billion, which I can lay claim to having helped a number of African countries raise money from the Global Fund. And that's actually a useful starting point for the conversation that we're having today. It's always hard to be asked to give a keynote, and give a keynote at the beginning of the day, because in some ways you have to say something compelling, but you also have to make sure that you're not stealing the thunder of everybody who's coming after you by giving all the information and data. So I'll be high level and normative, and I'll allow all the other folks who can go dig into a bit more detail to get into the detail, because to solve this problem, we actually have to get into the detail. So I'll pick up where Vivian, one of the things that Vivian mentioned is, generally it is correct that the era of big aid feels pretty much over. Most of that was sparked by the US government's shutdown of USAID, but we've seen the dramatic retreat that even the other bilateral donors have had, either in their direct programming or through vehicles like the Global Fund, Gavi, and others, that the replenishment's actually struggling, right? 5 years ago, 3 years ago, these were things that people were naturally inclined to contribute towards. We've seen the Global Fund replenishment did not hit its overall target. It's much better than I expected, to be honest, and I think many people expected. But to close that gap will take even additional effort. And so the era of relying on external funding to drive Africa's health agenda is increasingly over, and we have to get ahead of that question. The second thing I'll mention is sometimes we get lost in the comparisons between the numbers. And I'll use one example that's my favorite example that I've been using all of this year. Is we estimate at Axum the amount of money that was making it that was coming to the African continent from USAID was between $4 and $6 billion a year, right? What was allocated was much more, but as we know, a fair bit of that was either just round tripping and going back to the US, or being largely spent in DC and the classic Beltway bandits, and then some of it making it down. So we're talking about between $4 to $6 billion annually. That is a big number and feels like a big number, but it is dramatically overshadowed by the amount of money we ourselves actually spend on health. So to give counterexamples, in 2024, the amount of money that Kenya received from remittances, so from the diaspora sending in, was $4 billion, right? Kenya's annual education budget, what we spend every year from government every year, is also $4 billion. What we spend in health, and Dr. Sultani can give us the more recent numbers, is between $1.1 and $1.5 billion a year of government spend, leave alone what gets spent from out of pocket, private sector, health insurance, and others. So we have actually been funding our healthcare all along, right? Nigeria is actually a great example. Nigeria spends about $21 billion a year on healthcare. 75% of that is private, comes from people's pockets, NGOs or corporations, or insurance, private insurance, 75%. Kenya is slightly better. Kenya, I think, is about between 25 and 30% is out-of-pocket expenditure. So Nigerians have largely been funding Nigeria's healthcare system. But because of the era of big aid, we allowed ourselves, because there was money that was coming in, we allowed our health system, how it was structured, how it was built, and the things that it was funding. In some ways, we abrogated the strategy part of what is the health system we need to build for our people, right? And now that that era of big aid is going away, the responsibility is very clearly back in our shores to say, of the money that we are raising that's going to health, are we actually spending it on the things that matter? The other thing that's important to remember is if you talk to anybody who has worked in international development for more than 10, 15 years, you'll recognize a key part of the reason why big aid was coming in for healthcare was because it was dealing with infections that frankly made sense. People didn't want those infections back in their shores. So they didn't want TB being, MDR or XDR TB being built in the African continent and all of a sudden finding itself in New York or in LA or in London or Berlin or any of these places. I'm not saying people want altruistic, that was fine. But in addition to that, it was also important to make the case to their citizens that we're helping manage these diseases where they occur so that they do not come back and infect our folks. That story changes with the non-communicable diseases that we are seeing rising dramatically higher in each of our communities and in each of our countries. In some places, beginning to increasingly cost as much, if not more, than what we spend on infectious diseases. So the ability of us to go out to the global world and say, help us manage diabetes, help us manage hypertension is much, much less, because that's kind of our problem, right? It's us and our behavior and our problem. And so that how we finance our health system increasingly comes back to, are we raising the right kind of money? Is that money available for the right kind of health system we need to build to tackle the challenges that are in our populations? I think it is the smart thing for Africa to do in the immediate term, so that if money ever comes back, it feels it's additional versus core. And I think for too long we thought of that as money that fundamentally drives our core infrastructure, our core healthcare infrastructure. Now, to get to what is a good idea, which generally taxes to finance things in the public sector, generally that's how you finance things in the world. Every single country raises taxes to finance public sector work in any system, including the healthcare system. We in our room will tend to focus on one thing, and I'm going to challenge us to think of 3 dimensions if we're going to be successful. An initiative like this has to start with, is it technically correct? Right? So have we thought about what money gets raised where, and what it gets applied to? Is it a technically correct solution? And most of us in the room are technicians, right? We see a problem, we create the technical solution towards that problem. The 2 things we fundamentally forget, and sometimes becomes the undoing of a great technical solution, is one, is it politically feasible? Do the politics of a country align that they actually can do this? And taxation, as we know, is a high political issue. In Kenya, we've seen what's happened with, when we were talking about reading the bill, the finance bill last year, and that is only beginning to pick up steam, not just in Kenya and other places, but other countries. Not just in Nairobi, but other parts of the country. Not just in Kenya, but other countries on the African continent. So the politics need to align, or we need to make the politics align for this to actually work. Otherwise, we will have a great conversation, we'll drink great coffee, we'll get to meet people we haven't seen in a while, and then we'll go home with a good technical solution, but we'll never go anywhere. Because the politics must make sense. So we have to understand what are the politics that drive conversations around taxation, and a lot of that comes to what's called tax morale. Do people feel comfortable paying taxes because they know those taxes will go to a good result or a good outcome or help them? Or do people generally view taxes as an extraction and something they must fight? And if we can't fix that, our conversation is dead in the water. The third piece, so we have technically correct, politically feasible. The third one, which we then also forget, is it administratively possible? Can you actually do the work to collect the taxes? Can you do the work to ring fence the taxes? Can you do the work to make sure these taxes are spent in the things that matter to this ecosystem? So in an ideal world, you raise taxes from tobacco, alcohol, and sugar. You ring fence that money, and it goes directly to the healthcare sector, and ideally to actually manage the NCDs that are caused by those 3 issues, by tobacco, alcohol, and sugar. That's the ideal outcome you're looking for. But administratively, each of those things are a significant hop. You can collect taxes. It doesn't mean that your healthcare budget goes up, right? You can collect taxes in the name of healthcare. Your healthcare budget might not go up. You can ring fence those taxes and say this will only go to health, but actually maybe it goes to general health, or it pays for health insurance for civil servants versus actually service delivery. So you have to think about the administration, the system that's in place that enables those resources to ultimately reach the outcomes that you're looking for, rather than just purely from a technical perspective. So as we all have this discussion today, yes, we need a good technical solution. We must ask, do the politics align? Or how do we get the politics to align? And administratively, how do we make this possible? Especially in the 2 countries that are, that are in conversation today, where healthcare tends to be devolved, right? So in Kenya, healthcare is not a national issue. It's a county level issue. It's not a federal issue. It's a state issue in Kenya. Those hops must make sense if the money will show up where we need to. So that's it for hopefully compelling enough without giving too much detail, but hopefully also setting the stage for the conversation we have today. Really excited that this is in person. Mercy and I remember we had this conversation. I said, if you met me and Sultani on a Zoom call, you'd assume we are the same height, and the only difference is hair. Clearly we are not. You'd assume we have the same energy. Maybe, maybe not. But please take advantage of being in the room with people who are leading this charge, these conversations in Africa, so that we can really get the transformation we're looking for. Thank you.
Thank you. Thank you very much. Edwin, let's give him a warmer round of applause. Or is it that the coffee hasn't been enough, or people haven't had breakfast, so that we give you a chance to grab a cup of coffee? Everyone is okay? Okay, all right. So thank you very much, Edwin, for that keynote. Things to think about, and the things we've been discussing about. We may have all of these very nice things, but is the politics aligned? Because if the politics of the day is on something else, and we have all of these lofty conversations, then we'll just have a nice technical conversation. We go home feeling very nice about it. We have, intellectual conversations that we're happy about, but at the end of the day, just stays here where we are. So we are hoping that, this conversation, after all the exchanges that we have, it moves to another level. And later on in the plenary, you'll realize that we are very deliberate on who we are asked to come into the room, so that it's not just the technical people, but the people who sit in those offices where the politics happen, so that they may be able to drive these conversations forward. Now, next we wanted to just have a lay of the land, if I may call it that, to see what is happening in different African countries. So we want to demonstrate how health taxes are being used to generate revenue for public health interventions. Like Vivian said, Edwina said, the situation where we find ourselves in as an African continent, we have to dig ourselves out. So we have to try and learn from what other people in the same boat that we are have done, and we want to now see what have other people done when it comes to health taxes. Has it worked? Has it not worked? Is it something that we can think about for Nigeria, for Kenya, so that it can now have not influence, but it can also just, inspire the plenary conversations that we'll have next. So for this next bit, I'll have the team from AXAM start the conversation, and then Dr. Olomide will do next. So are we projecting? Okay, we project, and also let's make sure we share with the team online so that they may be able to see the presentation. When we are now here physically, we may forget that we have a whole team that is online, so make sure that we share that presentation with them. Karibu. Oh, this is Jonathan from AXAM, but he'll do the final introduction.
Thank you, Daktari. As she mentioned, my name is Jonathan Munge. I'm a manager with AXAM. I'm here representing AFIA, that is the Alliance for Health Financing in Africa. And as the stage has been set, the very premise of the initiative is to advocate for greater fiscal spend in health across the continent. So not just looking at Kenya, not just Nigeria, but we do have ongoing projects in Ghana, in Zanzibar as well. Hopefully with our partnership with Nigeria Health Watch, there'll be opportunities to work a bit more in Nigeria as well. So pleased to see so many of you here today. I won't repeat a lot of what has been said. I think Edwin has done a great job of setting the stage, Vivian as well, on the state of ODA funding. I'll just give you some numbers of what it looks like and where we are. And I'll take you through the presentation briefly. If we can look at the slide 2, table of contents. A lot of this has been touched on already. Why are health taxes important? Taxes on tobacco, alcoholic beverages, and sugar-sweetened beverages. I think those are the 3 areas that are key when we look at health taxes. And some of the numbers in Africa are interesting. If we move to the next slide, I think we're all aware of the triple benefits of health taxes. They curb unhealthy consumption of different, I would say, vices. And WHO estimates that about 40 million people die annually from communicable diseases, which is an alarming rate. The other area is earmark taxes have been talked about. They generate revenue, something that I know a lot of African countries are focused on, particularly with increasing in debt and what that looks like for national spend, and certainly just easing the burden on, I would say, the health systems across the country. So those are the three areas that we move to the next slide, some of for different countries. As you can see, I think they've done a job of being able to earmark and tax various areas. So about 40% between 1993 and 2000 to cut tobacco consumption. Sorry, my mic is a bit in and out. Hopefully this is a bit better. In other countries, for instance, in Russia, higher alcohol taxes actually helped to contribute to a 50% decline in consumption between 2003 and 2016. So these numbers can actually change the consumption and consuming patterns of a society at large by just making it more expensive, less affordable to indulge in these various areas, and not only improve the overall health of the population. If we move to the next slide, bringing it closer to home to our African colleagues, we can see that the increase in government revenues is something that I know people in this room, particularly people who work in budget committees, revenue collection agencies, probably know about, but need some more encouragement to get along with. In South Africa in 2018, excise taxes in sugary drinks resulted in a 29% reduction in tax beverage purchases and about 51% less sugar intake in the industry. So that generated about $319 million in tax revenues were collected in those first 2 years. That's an astonishing amount, and I know it seems like a drop in the ocean, but that was $319 million that the government didn't have 2 years prior. The similar cases can be seen across Botswana, in Ghana. In Ghana, for instance, taxes on tobacco products led to tax revenue doubling from $5.4 million in 2021 in 2023. If we move on now to look specifically at taxes on tobacco, I would say what we found was interesting is that there's a higher prevalence rate of smoking in more developed or richer nations. And we'll see that in the next slide that I show you, that positive correlation between, I would say, smoking and tobacco taxes is something that we need to probably take note of. And if we look at it across the industry, particularly with alcohol taxes, and I would say spirit taxes, there seems to be greater regulation in the tobacco industry as a whole. And I think that more alludes to just generally how the globally tobacco industry is regulated. Stricter enforcement from WHO is something that is also being observed. The number that WHO puts at the taxation rate is about 75% of the retail price. So you can see that's pretty punitive in terms of that taxation rate, much higher than you'll see in alcohol and sugar-sweetened beverages. That is something we need to take note of, and I think that number is something that's going to come up, particularly as we look at other African countries. How are we taxing in Kenya, for instance, in Nigeria? Moving on to the next slide, and this I mentioned before. You can see the map is showing what smoking prevalence looks like on the left. As you can see, it's much higher north of the continent and southern part of the continent as well. There's also that positive correlation between smoking prevalence and GDP per capita, with wealthier economies simply just smoking more. I don't know what that says. Maybe they have more time on their hands, they have more time for other vices, or maybe we just like drinking compared to smoking. I'm not sure what that correlation is. But these high taxes are something that I think can be implemented certainly in this belt, particularly around the equator, where you can see it's much lower. The white countries shaded in white is not that they don't tax them, it's just that we don't have that data. So hopefully that's something that changes over the years. In the next slide, I'll talk a bit more about taxing on alcohol. And I mentioned this before, specific alcohol content-based taxes are most effective in minimizing consumption. So this particularly for unregulated areas, so ethanol or alcohol-related harms can actually cause serious damage in society. In Kenya, that informal industry or a beverage is known as changa. I'm not sure what it's called in the rest of the world, particularly in Nigeria, but I know that it's going to be prevalent there. That, by nature, is going to be much harder to tax. And there are going to be cultural norms there or practices that make revenue collection in that area, or specifically with that kind of informal consumption, much harder to take on board. But when it comes to different types of taxes, I think there are also areas such as unitary specific taxes. So those are most effective in raising the prices of cheap alcohol, therefore reducing affordability and just curbing the initiation or consumption of those low-strength, low-priced beverages. But tax policy should take into consideration the administrative burden of implementing the chosen policy, as well as the overall objective. So for example, discouraging purchase of cheap alcohol by young individuals, I would say, is probably a key consideration beyond just the revenue collection aspect. So there's that, I would say, moral or obligation that the health ministry or health stakeholders do have beyond just the physical returns. If we move on to another chart for the next slide, here we can see taxes on beer and taxes in spirit. And what you can see from the chart very quickly is there's just a higher standard deviation or range on the taxes on spirits. And again, we don't have this across the continent, but you can see in spirits, those numbers vary widely. And why that is, I would say, again, we can only assume, just because maybe spirits are more difficult to tax, they're less tightly regulated, there are sometimes cultural norms that come into place. The beer industry, for instance, it's probably more tightly controlled by a few big corporations when you think Heineken, Diageo, so working and taxing those industries is a bit easier compared to the much smaller operations that you may have for spirits. If we move to the next slide, we now look at taxes on sugar-sweetened beverages. And here we can see that taxes on these average about 21.8%, but also with a wide range. So this is as high as 41% in Niger and as low as 5% in Cape Verde. Most countries levy a combination of both excise and VAT on these sugar-sweetened beverages, with the majority using VAT. Excise taxes range between 6.1%, while VAT averages about 13.6%. When it comes to Kenya in the next slide, some quick numbers. If you remember the figure of 75%, which is the WHO recommendation on taxes on the retail price, at Kenya it's about 31.4%. So I'm not sure if that's lobbying by very powerful players, but certainly there's room to increase that number to about over 40% to reach that WHO number. So there is probably room to work with any revenue officials in the room at the moment to look at how we can readjust this policy and then see what that impact is on increasing tobacco taxes. When it comes to beer taxes, it's about the same range, it's about 36%. That contributes about 22.3% from excise tax and about 13.8% on VAT. I won't spend too much time on those numbers. We do have this presentation available for you all, but just to put into perspective of where Kenya is vis-a-vis the rest of the world and those kind of standard regulations or recommended tax brackets. If we move on to the benefits and challenges of earmarked taxes, and I think this has already been, I wouldn't say any of this is groundbreaking. We know that linking taxation more closely to beneficiaries allows us to collect more revenue, increase efficiency in terms of how those taxes are used, improving accountability when it comes to providing that link between tax and expenditure, protecting revenue. So the idea of ring fencing from competing budgetary needs and political interests. But that could be a double-edged sword, which I go on to just now. And then finally, just as an advocacy tool to garner political support is an important aspect or benefit of earmarking these taxes. The challenges, of course, include budget rigidity. At the moment, reducing or leading to inefficient allocation. We know that currently, I would speak to Kenya, the budget as a whole is difficult to break down when you go beyond sector. So being able to apply or ring fencing these taxes is not an easy task, and being able to make sure those taxes are adequately or directly allocated to the area that they're supposed to benefit is also not easy to do. There is special interest groups that we need to be aware of that may, I would say, exert influence. So very powerful players, obviously, work in the alcohol, in the tobacco industry, and also in the beverage industry. So managing that is going to be important. There is also the, I would say, pro-cyclicality of earmarked revenues, which reduces the government's flexibility. So if these cycles change, it'll make even budget planning even more difficult than it already is currently. And then finally, I would say fragmentation when it comes to health financing or coordinating with other social sectors is limited as a result of that earmarking. So while we know that there are direct health benefits, tax benefits to earmarking, I would say, taxes, there are significant challenges that need to be overcome. And these are examples that in the next slide that I would say look at. So for instance, some good examples in Botswana, about 30% of the production cost of tobacco products is used to fund the Ministry of Health. So from 2014, that was intended to be used to fund promotion activities, including the tobacco cessation, rehabilitation, and public education. So Botswana has been able to do that by earmarking about 30% of those tobacco revenues. In Chad, for instance, revenues from excise duties in alcoholic beverages, 10% excise on beers, 15% on wines, 20% on liquors, are being used to directly fund universal healthcare coverage. So UHC is a popular term that we use. Chad has been able to show how they do that with various taxes. If we move on to, I would say, the next slide, particularly if we jump straight to slide 15, because we've talked a lot about these barriers, I would say one of the things we need to be aware of that these barriers are not just technical, but also political and cultural. So there is an aspect of advocacy, and I know a lot of us play a big role in advocating for this change, but there are also cultural nuances, depending on the country you're in, that need to be considered as well. I did mention alcohol consumption. One thing I didn't mention is alcohol consumption is also used as part of cultural practices. I would say as a Kikuyu, we know that alcohol is used, for instance, in wedding ceremonies and various events. So there are those nuances that need to come into place. Maybe not as big, but still need to be considered. The other aspect is the coordination across ministries. So there, it becomes a cross-cutting obstacle that we need to be aware of. So enforcement, regulation is going to be important, in as well as revenue collection across those industries. So working together harmoniously across national and subnational government is going to be important. And then finally, data. You saw some of the charts I showed you. We simply don't have enough data to be able to tell us what the effects are and likely impacts of these taxes. So we do need to get better at collecting this data and analyzing it to be able to accurately predict what these taxes are going to do. So in summary, I just want to say the way forward has been mentioned here. We need consistent leadership. We need strong collaboration. So kudos to Willow Health Media, to Nigeria Health Watch, to AXAM to be able to bring stakeholders like this in a room to discuss these issues. It is the first step in that collaboration. And then the progress requires, I would say, greater alignment between the health and finance ministries. So a lot of the work we do is directly related to the finance ministry, even though we are advocating for health. They cannot be left out in these conversations, even though it is a health conversation. So that would lead to better enforcement, stronger public trust, and I know a few of you here are in media, so how do we get this publicized and the impacts of this to be able to get the public on board? And then finally, using evidence to make sure that message is clear. And with that, I want to say thank you to everyone in the room, and I'll hand back over to Mercy.
Thank you, Jonathan, and the team from AXAM for taking time to scan through Africa, scan through the globe, and give us that rich presentation that will inform the rest of the conversations that we will have. Joining us online now to hear the perspectives from Nigeria and also just from the lens of the World Bank is Dr. Olumide Okunola, Senior Health Specialist with the World Bank Group. He'll be doing his presentation online. Are we ready for Dr. Okunola?
Yes, thank you very much. Do kindly confirm that you can see my slides and that you can hear me.
Okay. So, Dr. Okunola, the floor is yours. We can see you.
Yes. Can you hear me?
Let's just make sure we can hear you also. Audio.
I can hear you.
Just a minute, we sort out the audio. Could you try and say something? Yes, kindly go ahead.
condition like diabetes, because these are lifelong ailments where the cost of treatment is not the cost implication of this emerging catastrophe. We show that, oh yeah, maybe tobacco use is quite low. But if you unpack, look at the of several of our health insurance packages is not negligible. In fact, it could be a game changer to the extent that what we're calculating from our taxes will literally plug all of the financing that is coming from development assistance for them. So just to emphasize that. I then go to the third point I'd like to make. Yes, we want increased taxes for pro-health taxes. What do we want to use it for? And I think that's also missing in several of our advocacy. But before I do that, I just wanted to share with you that this is a slide that's circulating somebody of Coca-Cola because the industry is not sitting back and just keeping quiet. The industry is active, working across governments globally to prevent this from happening. And you can see the kind of strategic mapping that the Coca-Cola had done in order to be able to address and prevent increase in our taxes. So we need to be a bit more nuanced in our advocacy to say, look, yes, we do want you to increase taxes. Second, our people, and the example that the colleague gave about Kenya, where look, the finance was assisted by young people and all, these are real things that our leaders and governments think about. But I believe that we have an instrument which we should deploy, and asking Vivian and colleagues in the room to say this is really the emphasis of meetings like this. We want to increase taxes from this product because they can be used for so. Let's go to Philippines, which in my view has the best example. Philippines and Thailand, they're my best examples in terms of the use of pro-health taxes. You cannot talk about universal health coverage in the Philippines without talking about the citizens' law. It was clear what the imprisonment was going to do. It was clear the beneficiaries from it. It was clear how it would be distributed. So overall, saying that look, yes, there are health consequences, but there are also revenue gains. But these revenue gains, yes, they can go to treasury. I will not go necessarily into earmark agreements, but whether it comes in through the budget and then is channeled to the health sector, let us be very clear about where and what we want to use it for. Same thing with Cape Verde, another country that has made rapid progress because this money was channeled into the health sector. So pretty much, I will say three things. We should not forget the basis why we want this agenda. Our health systems are not configured to battle for what is coming. The number that is coming is unbelievable, it's almost catastrophic. So right now, since we are not structured for treatment, we need to place a whole lot of emphasis on prevention. And perhaps one of the best instruments for prevention is in reducing the demand by appropriate returns. Of course, when the money is on the revenue side, it's a win-win for both the treasury and the Senate. But one way that the treasury can use this to win the minds and hearts of the public is to very clearly show that straight line of how the money has been used, like in Philippines, Thailand, India. In fact, for the Thailand Health Promotion Board, what they did with the money was hardwire the money to prevent and work on lifestyle prevention for non-communicable diseases with very significant results. And I believe these are the kind of things you also want to incorporate into our
new revenue, but why are we actually having that conversation? So next we'll have a very brief panel. It's supposed to be around 45 minutes, but we'll do it for about 25 minutes so that we give a chance to everyone in the room to now be able to ask any questions, if at all, to be able to give any comments on what has been discussed so far. So 3 of our panelists are here. One will be joining us online, Dr. Taiwo Oyedele, the chairman of the Nigeria Presidential Fiscal Policy Reforms Committee. Okay, I can see him, right? I just realized I don't have my specs. Okay, thank you. He leads the national efforts to strengthen fiscal governance, improve revenue systems, and advance sustainable economic growth in Nigeria. He has over 20 years of experience in finance, taxation, and economic policy, including in his previous role as partner and Africa tax leader at PwC. He brings deep expertise in designing evidence-driven reforms across the continent. Let's appreciate Taiwo for joining us in this conversation. In the room is Dr. Sultan Ndechero, the Deputy Director General at the Ministry of Health. Karibu, Daktari, you can take a seat. He is a consultant clinical pharmacist for about 20 years and now Senior Deputy Director at the Ministry of Health. His key contributions include establishing and revitalizing the National Neglected Diseases, Tropical Diseases Elimination and Control Program, the Kenya National Public Health Institute, and the National Quality Control Laboratories, 3 areas that I know Dr. Sultani for many years has been very passionate about. He has chaired the African NCD Program Managers Community of Practice and the Leishmaniasis East Africa platform. He's been very instrumental in Kenya eliminating some of the neglected tropical diseases. Globally, he's the vice chair, was the vice chair of both the WHO's Working Group on Amendments to the International Health Regulations and the African Union Steering Committee on Global Health Diplomacy. He also chaired AU's Policy Advisory Stakeholders Group on Epidemic Science Leadership and Innovation Networks. Karibu sana Daktari, let's appreciate Dr. Sultani. From Nigeria, from the Nigerian National Health Insurance Authority, is Dr. Abubakar Kurfi, who's the Director of Planning, Research, and Statistics. He's a medical doctor with a master's in public health and an MBA in international healthcare management from Frankfurt School of Finance and Management. He coordinates and drives the strategic and operational planning, as well as policy formulation in the NHIA, so as to advance the cause of universal health coverage in Nigeria. In addition, he also oversees monitoring and evaluation, risk management, and health and social science research, and at the NHIA with a focus on strengthening the health financing system in order to improve the functioning of the health system towards UHC. And you know, when Dr. Okunola was doing the statistics from Nigeria, 8 out of 10 Nigerians don't have health insurance. I was telling Dr. Abdi here, who's the chair of Social Health Authority in Kenya equivalent, that he's done well because now he's been able to register over half the population of Kenya, 27 million Kenyans at the Social Health Authority. So it's good we'll get to hear a lot more from them. Then last but not least was our keynote address He says it in its introduction, but I'll just do it. Edwin Macharia is the co-founder of AXAM with over 20 years experience leading large-scale donor-funded health and systems transformation programs across Africa. At AXAM, he provides the strategic oversight of flagship initiatives, including what Jonathan was presenting earlier, the Alliance for Health Financing in Africa, which is a Gates-funded program that drives sustainable, domestically financed health systems. His expertise spans strategic planning, institutional design, and partnership management across sectors that intersect policy, finance, and public health. Do I continue? Oh. All right. Karibu sana.
That's it.
So I want to start with Dr. Sultani. You know, as we were doing the presentations, so when you increase tax on some of these seen goods and seen commodities, then you're likely maybe to have reduced consumption, which overall maybe will lead to reduced revenue from the taxes. So then it looks like it's a zero-sum game. What really are we looking for in this?
Yeah, thank you very much, Dr. Masi Korir, for that very good question. Actually, that is one of the areas that we have to look at very carefully, even as we now look at how we can raise more money to fill in the gap that has been left by withdrawal of ODA. We know that it is a bit of a conundrum because when we increase the taxes, then we expect that consumption will go down. And that is the ideal situation. Because I always look at these sin taxes not from the perspective of revenue generation, but from the perspective of a public health intervention. Because what we are doing is that we want to make the access to these products so punitive so that the consumption will go down, and then we will have our populations now, the triple benefits that our colleague talked about from AXU. We can be able to see a little bit of that, you know, especially the first one, where we are cutting down on the deaths and the mortalities. However, the conundrum starts by looking at one of the unexpected effects, because as we increase the taxes, then we are not sure, and I think it is Olumide who alluded to this, we are not sure that we are going to achieve the public health objective, because when we increase the tax so much on beer, then the people will start taking local brew, changa and others. When we increase the tax so much on cigarette, then they'll start smoking something we call kiraiko. You know, they just make it at home and they smoke. And when you look at these alternatives, then they pose even a bigger danger than what they are stopping to smoke. Nonetheless, then I would say this, that even if we are looking at a reduction in consumption, then we need to really, our entry point into the sin taxes, and this is where we usually miss the point, our entry point should be the public health objective. The money that is raised out of this intervention is a side effect, you know, it is a side effect. So at the end of the day, we will find that we are celebrating reduction, and I think Olumide actually put it very well when he said, we have to do it effectively, you know, efficiently, well. We have to raise the taxes well. So there is a balance that we can strike. That is really what we need to be looking for. At what level are we going to now achieve reduction in consumption? Now, at the end of the day, as we are celebrating the reduction, because we have achieved our objective, we will now have a problem. We have money. What do we do with this money, a side effect of this intervention? And that is now where we say we need to ring fence this money so that it becomes a kind of compensatory fund or a contribution, a compensatory contribution which can be ring fenced to deal with the effects of these items or other healthcare, public health problems. So I think we really need to look at it from that angle. And once we do that, then the total reduction in revenue collected becomes a much smaller problem. What I'm avoiding to say is that, and I think someone talked about Philippines and other countries that have done very well on syntax. One of the things that we don't know, or we don't see, or we choose not to see, is that when the reduction happens, not just the local alternatives, but we also have very many alternatives that are coming into the market. We are experiencing that in the tobacco space in Kenya, where now we are seeing these nicotine pouches coming in, vaping devices coming in, and so we will have to quickly be fluid enough to also bring those alternatives into the dragnet so that they can also be taxed. Thank you.
Okay, thank you, Sultani, for that. The public health angle to look at. Next question, I want to bring in Taiwo, who's joining us online. Taiwo, what elements are most critical to ensure health taxes are designed and implemented effectively, revenue and health impacts, like what Dr. Sultani was talking about? Just a minute, we fix your audio.
Maybe we should get Taiwo to sing a song so we know when we can hear you.
Yes, can you hear me now?
Now we can hear you.
All right, thank you very much and good morning. Sorry I'm not able to join you in person. Thank you for inviting me. So I think, maybe just to give a bit of policy context, I think the conversation is always the one that generates mixed reactions and interests, depending on who you are speaking to. For us in Nigeria, what we've decided to do is to adopt a dispassionate approach. It's not always that the industry players are wrong and then the advocacy groups are right. So sometimes the right answer or whatever is closest to that is somewhere in between. So for us, we have been quite open to everyone, all stakeholders, and trying to use data, not just data, but using those data within context. Sometimes the question you'd ask is, are we able to differentiate between correlation and causation? Are you able to consider all the other issues that you may be leaving on the table? It's very easy to say, let's tax tobacco companies on their production, beverage companies, including sugar sweetened beverages. But I'll say to you easily, in a place like Nigeria, you easily find people buy, added sugar off the shelf, and they don't pay tax on those. So we also have looked at the tax design. How do you even design the taxes you want to impose on these products? And one thing that we're doing now, we're just about finalizing it, is that up till now, we used to tax the volume of the products. So you just say, 10 naira per liter or whatever it is. You say 20% and that's it. Now we're shifting into from taxing the product into taxing the harmful content. For example, for beer, we say, why don't we say X amount of tax per pure liter of alcohol? So that way, in fact, by the time we converted our current regime to this new approach, we easily realized that spirits were being significantly undertaxed. And that raises the question as to whether it should be ad valorem or specific. Our view is that specific is better because ad valorem has a way of not getting to the lower end, and I think the previous speaker mentioned it, or product that can even be more harmful, sometimes totally evading taxes altogether. The second issue I want to raise is the holistic approach, why that is very important. You need government to be on board, you need the policymakers to align, and you also need the political will. We have this going for us in Nigeria now. We do not want to lose the opportunity. So one of the things we've decided to do is to develop a policy framework for taxation of SIM products or lifestyle tax, whatever name you want to call them, essentially around tobacco, alcohol, and sugar sweetened beverages. So once we have that policy and it's adopted, then Nigeria can then have a direction rather than different stakeholders pushing us in different directions per time. And also to consider the economic impact. You know, we will not be saying the whole truth if we just assume that taxing these products will solve all of the problems. So there are instances where if you are not careful how you impose the tax, and if you are not systematic in how you raise those taxes, if you create a significant increase, you're going to create dislocation easily. Remember that whether you like these products or not, millions of our citizens, earn their livelihood from this, from the retail shop to the input provider to the vendors to the employees and the taxes that they pay to the government. So we must balance all of these different considerations. It's also important to consider context, which I mentioned earlier on. So in some of the developed countries, like Europe and the US, they tend to have low inflation. And therefore, if you impose a tax of, say, 20%, then that's significant enough to discourage behavior. Whereas in many of our countries, that's just 1 year inflation. So we saw that some of these products were adjusted for inflation recently by more than 100%, just their own pricing, not even tax. And consumption has not been really impacted. So they seem to be price inelastic to that extent. So it's important to then consider other complementary interventions, including education, behavioral changes, and social issues. So finally, what I will mention is, in terms of the health outcome, we need to think about how do you finance, health impacts, and not just now, how do you make it sustainable? So in Nigeria now, what we are working on, we actually have a bill now with our parliament to try and earmark a certain percentage of taxes from these products into health impacts, and then not just that, measure the outcome and ensure that we can make it sustainable. So let me stop there.
Thank you very much for those policy questions and policy considerations. I think also the Kenyan space, the issue of volume plus versus component is one of the discussions that we'll have here. And at least we're joined by somebody from KRA. We'll get to introduce her later and get to hear insights from that thinking. Now, let me ask Dr. Kofi. What role do you think well-designed taxes could play in expanding insurance coverage?
Thank you very much. And on a lighter note, you said the population of Kenya covered with health insurance is 27 million, right? So that's what percent when you compare it to Nigeria? We have 21.1 million Nigerians currently as of today covered with health insurance, and that's just less than 9% of Nigeria's population. So you are 27 million is maybe an achievement, but when you put it into the country, and I'm not undermining the reforms that have gone through in Kenya, I'm aware of the developments that have. So in the context of what has been discussed, right, I think there are some critical variables that we need to take into consideration. One, of course, is the role of data in this whole discussion. The data that, for me, that really stands out is really the burden of disease as far as non-communicable diseases is concerned. So we look at what is the prevalence of these non-communicable diseases in the society. We look at really what is the cost of these non-communicable diseases on the individual, on the household, on the community, and on the society. When you have this data, it will help you now to move forward to the level of, okay, now what is the impact, what is the outcome of this on morbidity and on mortality. And in the context of Nigeria, I want to say that really we have not used data the best way that we're supposed to use it. And I'm happy that Dr. Taiwo is mentioning how they want to go back to the use of data to really serve as a guide for decision making as far as taxation is concerned. And so that's one angle. And the second angle, when you say, how do we position the NHIA, right, to benefit from this? So I want to go back to what Olumide said, that most benefit packages in the health insurance are designed to provide very few essential services. However, in the case of Nigeria, it's a little bit different. Our benefit package is one of the most comprehensive as far as health insurance is concerned. It provides both curative, preventive, rehabilitative services, even for the programs that are designed to cover for the vulnerable, like the Basic Healthcare Provision Fund, which is for people who are at the extreme level of poverty in the society that the government pays for. We really resisted the pressure of providing small packages versus providing comprehensive package for few. And then this is a trade-off that will need to happen among the health insurance ecosystem. They tell you, no, if you have small money, why not just provide small services for this and that? So for us in the NHIA, we really resisted that, and our benefit package is the most comprehensive. So because of this comprehensive benefit package that we have, I think we stand on the pathway to really benefit from something, this kind of tax systems, to say, okay, why not channel these taxes that the government is doing into provision of universal health coverage? Because as we know that the NCD cases are rising, so also that these people that have these diseases, they can also suffer some comorbidities and comortalities at the same time. Thank you very much.
Thank you, Dr. for that, from the Nigerian lens. Before I come to the plenary, let me ask Edwin, what key strategies can help African governments, you touched on a bit, to leverage health taxes as a reliable and accountable mechanism for sustainable health financing?
Yeah, no, great question, and one of those questions where there isn't one easy answer, right? And if somebody was coming here thinking, I'm going to get the easy answer through this, the easy answer doesn't exist. Because a lot of this is about finding the right balance, right? And there are multiple things you have to think about balancing. So the first one is, industry will make the point to your head of state, to your minister of finance, to your revenue authority, exactly what Taiwo said, that they are a major part of your economy, right? In Kenya, several years ago, before the telecom boom happened, the largest payers of taxes were usually the beer companies and the sugar companies, essentially, right? And that's what they pay, the corporate tax, employees, the entire distribution mechanism down to the classic, is there a Coke nearest to you? That entire value chain is financed by their work and financed by the consumer. And so we are a major employer in your country. We pay lots of taxes. Increases taxes on us is bad for your economy. You want to do it. They do that, and that happens. So that's the wind that will be coming against any reforms to say we need to increase the taxes. Second level is to recognize almost every single African country has some level of taxation for tobacco, sugar, and alcohol in some shape or form, right? It's already in the books. The question is, what's the level of that taxation? Which in some ways makes our fight slightly easier, because now it's not about introducing something new. It's about getting that where currently is not the right levels to whatever we think the right levels are. But we have to find the balance between we who come from the public health side and say it is important for the consumption of these products to go down to as close to zero as possible, with the reality of there is industry, there is jobs, there is tax revenues that come from the other side. And then when you peel back the layer is, once collected some revenue, how do we spend it? Many of us in the room who work in the health sector tend to go and advocate to the head of state and our Minister of Finance, and say to them, you need to increase taxes, you need to increase how much you're spending in health, for the following many reasons. And we're usually correct in exactly the many reasons why. What we always forget is every single executive is sitting with a zero-sum budget. For them to put more in health, they have to reduce somewhere. And unless we engage and have the conversation on here are the savings you can get in other parts of your budget to release money to be able to invest more in health, of course they will say, yes, I want to spend more on health, but I can't. And so what are the things that we're doing that are increasing revenue, which is what we're talking about, or decreasing expenditure, which is another conversation that needs to be had on the structure of our public finances that every single African country is carrying, and therefore what we are paying from a desk, to essentially service our debt is way too high, but they have constraints. And so if we say we are raising revenue and then automatically constraining it and earmarking it for something specific, recognize that there's a cost to that earmarking. And when the world changes, are we able to reverse and be responsive to the reality on the ground? So I think to me the critical question is we need to understand the data of what's happening in reality, level one, right? We need to actually know. A lot of the data that we even pulled together that Jonathan showed, some of it is old data, right? Some of it is 2018, 2019, 2020 data. The world is different post-COVID in so many different ways. We actually don't have the current good quality data to help our policymakers make decisions on what is happening today, not what was happening 5 years ago, not what was happening 10 years ago. So we need much better data, much more granular data. And then we need to create the platforms for exactly these conversations that highlight the cost of consumption of these products on our communities, on our people, on society, is only growing and growing at a much faster pace than even GDP growth, than almost any economic metric that any heads of state or minister of finance is sitting with. Maybe debt might be the only thing that's growing similarly fast. But the cost that will impose on our health system, it's one of the fastest growing costs that any country needs to bear. So with the beginning of that understanding, what are the levers that can be pulled to reduce consumption of these products, and ideally be able to walk down the path of much less prevalence in our communities. But we shouldn't assume that just by doing that is enough. We need to actually walk the journey, make sure we have the right information, the right data, and the right platforms to find the right balance between what is taxation and what is the impact, and what does that mean for what is in reality still a significant part of our economies and industries.
Thanks, Edwin. Let me come to Taiwo. You've heard what everyone has said at the panel here and before. And for some of these fiscal reforms, they require really serious and strong multi-sectoral alignment and coordination, and most importantly also that political commitment. And the nature of African countries, Nigeria, Kenya, and any African country you can think of, is we live for every political cycle where things change. And so how do you ensure that this alignment and coordination is sustained despite who is in power at that time of the day? Okay, just a minute. Just hold on, Taiwo. Are we ready? Yes. Just say something. No. Audio. Not yet. Okay, as we sort out Taiwo to come and answer that question, we'll be coming to you next. Any comment, any question, you'll just raise your hand, and then we'll bring the microphone to you. Could be a question to the panelists. You can see the two up here. Moses. So we can pick a question or a comment as we sort
with the Nigerian Customs Service.
Allow me to just...
It's on. All right.
Is he on?
Can you hear me now?
Go ahead,
Go ahead,
Taiwo.
Taiwo. Can you hear me now? Yes. Okay. All right, thank you. So just to say, I have to exit in 10 minutes for another engagement, but great question in terms of how do we ensure that we have this coordinated approach? So this is one area where government generally tends to struggle. Sometimes it's about the data we're using, it's about the direction of travel, sometimes it's about the communication. And getting all of that to be aligned is always very difficult. One thing that seems to be working for us in Nigeria at the moment is the approach that the government has adopted is to set up a presidential committee that is helping with that level of coordination. It's not perfect, but it's been working much better than the approach we've adopted in the past. So for us, one thing is an integrated policy development approach where we're trying to bring input from the health ministry, finance, from the stakeholders, from revenue authorities, customs. In Nigeria, our customs service and revenue service are separate entities, and we're having to align those things as well. And the other important thing is just ensuring that while we are progressing with the reform, in terms of the policy that we want to approve for these taxes, that we're able to consider all the data points, even from our international friends like the World Bank. We also have the advocacy group that we're also taking into account. For us, it goes even beyond just the whole of government approach. It's more of the whole of society approach. And we are also grateful for the political will that we have to push these reforms through. So overall, we think that we're learning from others. We also have a few things to share with the rest of Africa in particular. And we think that ultimately we'll be able to strike this delicate balance between protecting our people in terms of their health, as well as allowing the economy to work because the unintended consequences, if you do this too quick and it's too fast without considering data and context, is you then push people away from productive activities. They still consume those harmful products, and then you get the worst of the outcome. So I think we can learn from others. We also can share our experiences with them as well.
Anyone with any question or comment to Taiwo before we can, release him from, specifically to Taiwo, because we need to excuse him from the meeting. Okay. There's somebody at the back. Okay. Because we're just taking specifically for Taiwo so that we can release him and then we'll continue in here.
Thank you so much. My name is George Iduka from Kenya Country Office. And I'm following up the ministers made before in the last in terms of the balance. We know that the experience that we are leveraging on tobacco was really easy because I know it was difficult, but in terms of the cultural and the harms that were there were evident. When you talk about like sugary, sweetened foods, ultra-processed foods, a whole big industries, a lot of cultural acceptance of these goods, a lot of mistrusts, the government when they are collecting taxes, especially right now, not being able to track how those taxes are being used. And my question is, how do we, especially because also these industries, they will use the social media, they will use all kinds of platforms to discredit any form of increased taxation that is proposed. How do we engage the communities to be able to push for these taxes? We know for it to be politically palatable, it must assure a politician of a win in the next general election. It must assure them of increased popularity. And this can only come from the communities, from the civil society. Because we push it from our perspective, again, it may be seen as maybe elites pushing it. So how do we achieve that balance and that buy-in? Thank you.
Thank you, Dr. Giduka. There's Akin Bode online. His question. Take two more here and then we'll get Taiwo to comment on them and finish. Akin Bode.
Thanks so much. Thanks so much, Mr. Taiwo, and it's good to see you again. And thanks for the great job you're doing. It's it's good to hear you speak about the structure of the taxes. And one of the challenges that have faced the SLB tax in Nigeria, which the amendment bill seeks to address, is the fact that it fixed it at 10 naira per liter rather than percentage at a point when the products were selling at maybe 80 naira per 55 CL, and it's doing 40 CL, and Nigerian revenue is static. And so it's good to hear that we'll be looking at the structure to look at how the tax regime, the tax system will be adjustable to inflation, and the government will not always be at the lower end of the stick. And I also want to pass on this information that we got news that the public hearing of that amendment bill might happen on Thursday. So I think it might be good to take note of that. Thank you very much, sir.
Thank you, and thank you for being very brief. You've set the precedent for everyone. So brief to the point, your name, organization, and your question or comment in brief, please.
Thank you very much. My name is Joy Ayemere from the Federal Ministry of Industry, Trade and Investment, Nigeria. Yeah, really a lot has been said, and all of those speak to the perspective of, I'm here for the ministry, so perspective of the ministry, because in all of this, we're just so concerned about how do we strike a balance between the public health objectives and industrial growth vis-a-vis the sustainable financing, domestic financing. So just in the spirit of multilateral or multi-sectoral collaboration, I just want to know, throw this question to him, if Federal Ministry of Industry is active in that committee.
Okay, thank you.
And if yes, I'm not sure it's from the industry side, because the Federal Ministry of Industry is a big one. We have the trade wing, the investment and industry. And in all of this, the industry really has a crucial role to play. So I just wanted to confirm to me if Federal Ministry of Industry, especially from the Industrial Development Department, is active in that committee.
Okay.
So that's it for him for now. Thank you.
Okay, thank you. Taiwo can take those two questions and the comment, then we'll come to the room.
Very much. So I hope you still can hear me. So the first one is about, how do you ensure there is balance? How do you have the people on your side while you try to implement this kind of reforms? So I think the starting point, it's not even to blame the industry players, it's to say whether government has done a good job and whether government is sincere. So if government comes out to say, we're taxing this product because we want to cater for your health, and they see that there's nothing that is being invested into health, then you lose trust. So which is why for us the approach is, first and foremost, let's be sincere with ourselves how we formulate the policies and how we channel the resources that we generate for health impact and outcomes. So I think once you are credible and you are authentic, you're likely to win the people over. It still won't be easy, because somebody wants to buy sugar sweetened beverage, they feel like you're trying to tamper with their way of life. So you need to make sure that that communication is authentic, is consistent, and is credible. So the second question is around sugar sweetened beverage in Nigeria. It was a comment, and this is one of the things we're trying to correct. Excise taxes, like import tariff, are issues for the executive in almost every country in the world. For some reasons, as a result of the lobbying, this became an issue for the parliament, and then they enacted the law to say sugar sweetened beverage will be 10 naira per liter. And now that's, it's not only just ridiculous now, it's almost like a waste of everybody's time because it's so negligible. So what we're also trying to do is to amend the law to take that power away from the parliament and put it where it should be, within the executive, where you can easily be more flexible with excise on this product. So the last one is from Joy. So of course, the committee that I have the privilege to lead It's a very large one, more than 100 people from more than 22 institutions of government, and then a lot of private sector involvement as well. So we do have representation from Ministry of Industry, Trade and Investment. We do not decide who represents the ministry, so we only just speak to the ministers, and then they decide who represent them. But more broadly, once we have our policy instruments ready in draft form, almost anyone who is interested will be able to make their own contribution to it. So we welcome more perspective and input from all stakeholders. Thank you.
Thank you very much, Taiwo. We can give him a round of applause. I can I'll allow you to exit, but thank you for making the time and your very, very insightful contributions into these conversations for the day. Thank you very much, Taiwo. So we come back here to the room. We had a question or a comment here, 2 of them. So you just tell us your name and organization, and if you have a comment or a question, very briefly, so that we give many people.
I go back to the earlier opportunity given to me, and I start all over. My name is Musa Omale, Deputy Controller General from the Nigerian Customs Service. My intervention will be anchored on some of the issues that have been raised on revenue here. I come from the background of where it is revenue, revenue, revenue. You will agree with me as a customs officer. We don't joke with revenue. But from what has been said, the head aspect of this sector is also very important. So it is now without prejudice to that head aspect. But there's a comment Vivian made when she was giving her remark. It's before the National Assembly on amending the custom tax, excise tax. It's very important. It has gone through the second reading and is before a committee now. And thank God somebody, a speaker now, raised the issue that the public hearing will be coming on Thursday. The aspect I want to intervene is the industry resistance is much in this aspect. From our own experience, we have real practical experiences of the extent that this industry resistance can go. So what can be done? There's much that Nigerian Health Watch need to do to counter this industry resistance. I'm not sure I heard you earlier when your comment that the Chatham rule does not apply here, if I heard you well. Okay. Okay, because of that, some information. If not, I would have given details or have this industry. We have real experience recently of the extent they could go. That. So to conclude, much need to be done. Because in Nigeria, like the beer sectorial group is one of the group that is really against all this effort. And then even it will shock you, the Japan Tobacco International recently to have an encounter with them. And they have gone all over every place trying to sabotage in coming up. So the question is, Head Watch, what strategies will you put in place to be able to code us in the coming public hearing so that their effort will be sabotaged? Thank you.
Yeah, so thank you very much. My name is Dr. David Hawaya. I'm an economist practicing in the health sector. I just wanted to make one comment quickly. I work at a Center for Epidemiological Modeling and Analysis. There's something I wanted to mention here about trying to distinguish the discussion around hypothecating taxes into 2 themes. One is about the tax regime. When we talk about taxing and people talk about increasing and so on, it will definitely be fought by the stakeholders. But here, I think we need to focus our discussion to earmarking and stop at that, because already it's being taxed. So what we are only saying is that can we give it color so that when it goes to the port, it has a color, we know where it's going. If we go that route, we will win immediately, and then come back to the other aspect where we now talk about can we then increase and so on. And when you talk about these 2 things, they have different players and different conversations around them. For example, when you talk about tax regime, you need to start talking about elasticities of demand. You need to talk about the Laffer curve and so on, which has a totally different discussion as opposed to what we are talking about when we are talking about hypothecating taxes for purposes of health. Because the two, if you put them to, somebody will actually push them back, but they'll be pushing back what interests them. And so, thank you very much.
Hello. Hello, my name is Anne Musuva. I'm a health system specialist. And thank you very much to the panelists. I have one question, perhaps for Edwin and Dr. Kurfi. I'm wondering, are there types of health systems or health financing architectures where sin taxes make more sense? So I'm wondering, for example, a country like Nigeria, where over 70% of health financing is through out-of-pocket payments. Is that the discussion a country like Nigeria should be having? Or should the focus be more, consolidating all these, pooling these out-of-pocket payments? So I'm wondering, what does the maturity of a health financing country, does that determine what sorts of domestic should be looking for? Thank you.
Thank you. My name is William Menson. I work with the One Campaign. I also happen to be a medical doctor. Thanks so much for all the points shared. I have a few reflections. The first is we are having this conversation against a certain background of historically low tax collections overall in this part of the world, where, for instance, we take 16 to 17% of taxes, over GDP compared to what the OECD countries do, about 34%. And so I think the conversation needs to be situated this way, and if, in addition to everything we are saying, improvements are made on that side, then overall we might not need, too much and would be able to meet our needs, alluding to a point Edwin made in his keynote. Secondly, I would also refer to something that was shared from the AFIA presentation. If as a continent, we are able to increase excise taxes on tobacco, for instance, to the recommended 75%, and some increases on sugar, sweetened beverages, and others. There's a potential to raise an additional, say, 30 billion USD a year over the continent. And this could go as far as solving about 25 to 30% of the modeled PHC funding costs. And so these things need to be situated in the face of the reducing ODs. And then the very last point, which I would make on credibility of governments suggesting to increase taxes on some of these things. The example I'll make is from Ghana, where I come from, and the National Health Insurance Levy, which is, I think, 2.5% of consumption. That also, my dear friend referred to. The previous government, for instance, put a... And so if whatever... 60, 70% went to health. And so were led into even the insurance. The current government card, and so now the health insurance is 100% of collections. And over the past 10 months, we have actually been able to see how well these things have done. One, provider payments are faster, very few delays. And the government, in addition, has been able to introduce, another scheme altogether. That's the Ghana Medical Trust Fund to take care of non-communicable diseases, from which you have as much as 20% of this money going to. And so maybe a quick thing of reflection for our panelists, that if governments really want to be taken seriously, if you want the support of your citizens, then it makes sense to do what you say. And of course, the resistance will come from different quarters, but now with what has happened in Ghana, and the system is by no means perfect, but I feel that today, if we want to talk about, increasing some excise taxes, citizens will be more willing to pay because they are seeing the benefits, than when this thing was capped and a lot of the money was really going elsewhere. And so we need to really walk the talk if we want folks to take us seriously. These are a few reflections from me. Thank you.
So thank you very much, and good morning, everyone. Thank you for this discussion. My name is Jacob Nato from Kenya Institute for Public Policy, Research and Analysis, KIPRA. So I think I've really liked this discussion because we really face a significant funding gap in the health sector, and therefore this discussion of earmarking and so on, I think it's quite a welcome move. So I'll just give two comments. The first one is on the modeling aspect. I'm happy I have a colleague from epidemiology here. That's good. So I think data and modeling will be very critical in this exercise because, as everyone here has said, this is a sector that has so many stakeholders who have various interests, the government, the health practitioners, the industry players, and so on. So I think it will be useful that this discussion, we bring all these stakeholders together in a collaborative approach. And at KIPRA, we have actually developed a model that can support this. It's actually called a computable general equilibrium, or CGE model, which assesses the impacts of taxes on alcohol, tobacco. I think we didn't do sugar-sweetened beverages, but I think now this can be the next discussion so that we understand the economy-wide impacts. So I agree with all the presenters that revenue should just be one of the items we look at, but let's look at the economy-wide impacts just to understand the impacts, for example, on employment from the sectors and so on. Then finally is the issue of the cross-border and illicit trade. I think Kenya, we have porous borders, and any efforts to raise, for example, taxes on, say, alcohol or beer, people are likely to. I like the discussion of changing behavior, so they're likely to cross the border, and therefore the issue of illicit trade. So even if we are to earmark these taxes, the way Dr. Hawaya said, I think there is still scope for increasing taxes based on the modeling we did, but it should not be punitive to the extent that it encourages illicit trade and informal. Then the last comment is just the issue of the design. I think this is where the real issue lies. So given that we have a national tax policy, I'm happy my colleague from KRA is here. We also have what is called the medium-term revenue strategy. So I think in terms of the policy framework, we are good. So the issue is the regulatory framework that is needed to support this. Thank you.
Thank you very much, Neto. Thank you, everyone, for your comments and questions. I'll start with Dr. Sultani, particularly on the question of, earmarking the revenue as a quick win and strategically allocating those funds. So where do you start when you earmark? Is it preventive services, treatment programs? Do you earmark it to Dr. Abdi in SHA, the health infrastructure? Like what do you do when you earmark or strategically allocate these funds? And any other comment you may have?
Yeah, thank you. Let me just start by affirming that actually that is a low-hanging fruit. It's a nice starting point. We have a very good experience with our tobacco solatium fund. I think we are working very closely with KRA on this. And we are finding that there is a lot that can be done in terms of just creating awareness, engaging the public. The resources have gone a long way in just engaging the general public towards making them understand. And this becomes a kind of like a snowball effect, because by the time we now start implementing some of the other measures in terms of increasing taxes, the general populace is already aware of what needs to be done. And then, of course, prevention is an area that we keep on leaving behind. And yet, it now brings out the scenario that I keep on talking about of two buckets, where one bucket is labeled resource mobilization, and the other bucket is labeled leakage. And the leakage bucket is bigger than the resource mobilization bucket. And, we keep on trying to look for more when whatever little we have is not going into effective use, it is being wasted. So if we can be able to farm up areas like prevention, then, and it is a strategy that we are even using generally for universal health coverage achievement, then it is going to make sure that the little resources we collect go into effective use. And then, of course, we go all the way into now interventions against some of the public health problems that have already started occurring out of the usage of these products. Thank you.
Do you have any comments from the other conversation?
Yeah, I think one of the things that really stands out apart from efficiency, I think in this whole discussion we really have to put efficiency at the center, because there's no way we are going to now introduce, we understand as stakeholders, but then there are much more, there are many more people who need to understand. So if we don't use whatever we have efficiently, it will not work, But apart from that, then advocacy. We really have to be good at our advocacy. We really have to send out, to package the message in a way that resonates to each and every member of the society. We have talked about, the use of data. How are we utilizing our data to be able to now package our message in a way that resonates? We really have to work on that advocacy piece for this whole thing to be effective. Thank you.
Thank you, Dr. Sultani. Dr. Kurfi, we've talked about, and there have been comments on data modeling. How would better data or good data help you in, the decisions you make in providing comprehensive coverage to your constituent or to your members, or making sure that your purchasing decisions are data-based so as to provide better services for the people under NI?
Okay, thank you very much. So, of course, insurance is about risk. So for us, data is very critical when it comes to decision-making regarding risk. And if you have very good data, you can be able to effectively manage your risks, but you can also be able to project, right? And say, with this X amount of resources, I can be able to cover Y amount of people over a Y number of period of time. And I can also provide them with X number of packages in the benefit package. So it's a very critical, data is very critical in risk management decisions. But there's an angle I really want us to flag in here, which is the equity angle. Vulnerability analysis cannot be done without data, and even the financial sustainability dimensions cannot be done without data. But really, we live in a society where the level of poverty is very high, and affordability of health insurance is also very, very poor. In virtually all the African countries, and if you look at their trajectory towards universal health coverage, you will see that covering the informal sector has always been a very difficult and a hard nut to crack. My thinking is that this is an opportunity. The SSB this tax can generate the revenue needed to really mobilize the resources to cover those that cannot afford to pay with health insurance. I will use that to answer the question with the lady from Kenya about the health system maturity and the rest. So I think it's an issue of really an efficiency discussion angle is there, but I think it's has to do with the value for what you are getting, right? So if you are able to mobilize this money for tax, is it wise to use that money to cover just one particular disease, for example, or one particular ailment, or one particular? Is it not better to use that money to purchase a comprehensive package of services for those who cannot afford to pay through health insurance? In that case, if somebody who has diabetes, for example, happens to have a road traffic accident, he still gets covered. If person that has hypertension happens to have to deliver, his wife is delivering, she or he also, or she is delivering, she gets coverage for those services. So I think we should channel this discussion towards really meeting the UHC aspirations of our nations. So how do we use these resources to really canvass and provide health insurance comprehensively for those who cannot afford to pay? We can make it a little bit biased towards these people who suffer the most of these conditions. We can say coverage for those that are 60 and above, 40, and look at the population segments that these products harm the most, and then provide some level of health insurance coverage for them. Thank you.
Thank you, Dr. Kurfi.
Yeah, I'll start with a bit of a kind of high level, maybe semi-philosophical view, because I think it is useful to ground in that, right? So I spent 17, 18 years of my life building what became the largest impact-focused advisory firm in the world, and I ran it as the global CEO. But 2 years ago, decided to shift and now build Axum, which is the firm that I and Jonathan and about 60, 70 people in Africa right now work in. And the reason for that shift was because too often we were very focused on what is an externally imposed technical answer to the problem versus recognizing the way you truly make change. There are two things that everybody must have if you're going to make change, but we in this room and many other rooms tend to forget and tend not to build it. One is, do we deeply understand the context in which we shall be operating in? And secondly, do we have relationships with the people who we need to convince to make a different choice? We have all seen horrible policy being passed because it was being fronted by somebody who had the relationship but didn't have the technical answer. Or folks flying in, flying out from external to our countries and our contexts, coming and imposing and saying, well, this is donor X's view or multilateral bank's view. And because they have that, but don't have the context, but they have the relationship, that passes as the truth. I forget who it is who asked, what is the thing that you want to start with? We have to remember, this is a multi-decade long fight we are in. It is not something we fix once. The effects of tobacco in causing harm to lungs and ultimately cancer, that started in the 1950s. The science was known in the 1950s, 70 years ago. We're still having the fight today on whether taxing tobacco is good or not. 70 years. So we have to remember this is a multi-decade long fight. And tobacco is easy because tobacco is, causation is fairly straightforward, right? When you think about sugar and alcohol, it is much, much harder. That 70 years we still haven't passed. We're still having this conversation today. Which then brings me to my second point. That is, we need to understand the fullness of the levers that need to be pulled. And then we have to be really practical on what are the levers we need to pull today versus what are the ones we pull tomorrow versus what are the ones we pull next week. We can't win it all once. If we can, fantastic. But the policy change window in every country for massive policy change in every country on a major issue comes up once every 10 to 15 years. And you have between 6 to 18 months to do a transformative policy change. And then that window closes and then you have to wait another 10, 15 years. But in between that period, you need to be at the forefront of what is the best thing that your country needs to do to achieve the aim so that you're still making incremental changes as you go along and you're absolutely ready when the policy change window opens for those 18 months, you are ready to make the dramatic shift that needs to happen. So for some countries, it is going to be, guys, we can't put new taxes on the books. Politically, that's just not going to happen. And that's just the reality of where your country is. And in a few years, that will open, but you need to be ready. In some countries, it might be actually what we can do is tweak the rate of taxation for each of these things, because most countries have these policies in the books, and you're moving it from 10 naira per liter to 100 naira per liter because that's actually where it should be. And the people who get you there is you will always need to find unlikely partners to get you to that point. Right? So you almost can't afford to be a purist that says, I will only work with people like me who have this solitary view. Because along the way, you will get half measures and half successes. So the example of Nigeria is a fantastic one on the 10 naira per liter, which industry got comfortable to push through because it was a negligible number. It's actually good that that number is on the books now, because now the fight is not getting that on the books. The fight is getting that number to be the right number, whatever the right number is for Nigeria. Higher than 10, we can all agree. Is it 100? Is it 500? Is it 25? Work needs to be done to get there. But now your fight has changed and your fight has shifted. The third point is efficiency and inefficiency are two sides of the same fight. Inefficiency is a strategy that is used not to get to the right outcome. There are people who will come and they'll agree with you, and then you'll pass the 10 naira per liter just because it's inefficient. It doesn't really affect them, right? And there are people who will use inefficiency to frustrate you or not to get to the outcome that you need, which ultimately for us is, are we changing consumption, right? And therefore changing the trajectory of NCDs in our communities and our populations? Leave alone, are we raising more revenue? If we can't change that, even if we raised all the revenue we could today, our GDPs would not be able to handle the NCD wave that's coming, right? It fascinates me, and maybe this is for the folks, for the Nigerians in the room. Nigeria today collects roughly the same amount of money that Kenya collects in taxes. It's about $19 billion a year. Kenya has a third of the population, plus minus, and half the GDP. So how do you use that as a basis to go to your stakeholders, Nigeria, and say, guys, we're the largest economy, or we want to be the largest economy, we have a whole population. To your point, Daktari, the leakage bucket in Nigeria is much bigger than the bucket that is collecting. Closing those gaps matters. But you need to be aware, what's the fight I'm fighting today? Because you're in this fight for 70 years, guys. So don't think it's a one-time thing.
Quite a lot to think about. Yeah. Let's appreciate our panelists for their valued inputs. Taiwo in absentia, Dr. Sultani, Dr. Kurfi, and also Edwin, we'll just call you Dr. Macharia. Thank you very much for those valid inputs, challenging us to think, and everyone that has given their comments for this conversation. I want us to take a 5-minute health break just to grab a cup of coffee or juice or something, and then we'll come back in with it so that we go to the next session, which is the plenary session, where all of us get to contribute. The first part will be looking at the implementation challenges and opportunities, and then the second part now will be more or less the way forward of the conversation. So we hope that we'll be able to cover that in about an hour and a half tops, so that we can have an early lunch. But for now, we'll just take a 5-minute health break. You can grab a cup of coffee or juice, and then you come back. And if you have any questions, any comments for the panelists here or the earlier presentations, we'll have an opportunity to do that at that point.
And thank you for facilitating.
All right. Thank you, everyone. The tea is to my right. There is a door here to my right.
In the heart of Busia County, where malaria remains a deadly threat, community health promoters, or CHPs, are the frontline heroes, battling poor roads, long distances, and limited resources. They have walked miles, literally, to save lives.
Niko na household 125 na singewezewa kuitembelea hizo nyumba zote 125 kwa mwezi, na nilichukua masaa 4 kufika kwa nyumba ile ya mwisho, na ningewahudumia wateja wangu ama ningetembelea nyumba 5 hadi 8 kwa siku.
but a new intervention is changing the game. Armed with bicycles, these health promoters are now peddling the way to faster response times, timely referrals, and healthier communities.
Nafaa nitembelea nyumba 107 kwa mwezi, na kwa vile sikuwa na baiskeli, hakuna siku nilifikisha hizo nyumba. Sasa nitashukuru shirika letu la Amref kutuletea baiskeli, sababu niko sure nitakuwa natembelea nyumba zangu zote 107 na nitakuwa nafikia kila mtu kwa wakati.
Na sasa vile tumepata baiskeli, ama vile nimepata baiskeli, nitafanya kazi yangu kuwa rahisi. Nitaweza kufikia ile nyumba ya mwisho kwa chini ya lisali moja, na kazi ama nitatembelea nyumba kuanzia 10 hadi 15 kwa siku, na huduma kwa kijiji changu itakuwa bora, itaimarika kulingana na minsi ambayo nimepata ya baiskeli.
According to the Kenya Malaria Indicator Survey, KMIS of 2020, Busia County had 39% prevalence of malaria, which is 6 times higher than the national average and 3 times higher as compared to other endemic counties from the lake and coastal regions of Kenya.
In all my talks with them, they've been talking about 3 things. Kwanza mnataka mobility, si ndio? Pili mkasema mnataka vifaa vya kazi.
At a cost of 4.9 million shillings, Amref Health Africa, with funding from GlaxoSmithKline, GSK, and in partnership with Buffalo Bicycles, has distributed 420 bicycles to community health promoters in Busia and Siaya counties to ease movement for CHPs like Patrick Kabuko and Selifa Olukali.
Na hakuna vile tutaangamiza malaria nchi hii kama wale wahudumu wa mashinani hatuwapatie vifaa za kufaa kuhakikisha kuwa wana prevent or control malaria katika vijijini.
With wheels in motion and support behind them, Busia's community health promoters are not just fighting malaria, they are racing towards a future where every household is reached, every life counted, and every journey made easier with a simple tool, the bicycle, heading Kenya closer to a malaria-free nation.
What happens when the world gives you only 2 choices but you don't belong in either?
Mtoto mwenyewe akaanza kuniambia, mama, hisia zangu mimi si msichana, mimi ni kijana.
They used to give examples with me and it used to hurt.
For years, they have lived in silence.
When they looked at my genital, the doctors and the nurse, they could not tell whether I'm male or female.
But now, they are speaking.
When I need to go for a short call, I have to go as a lady.
And when you hear their voices, you will never forget them.
We were recognized by the government. At least the government said, oh, these people do exist. And then they enumerated us.
After years in the shadows, their voices will be heard. Only on Willow Health Media.
You see, when somebody is on medication, this person depends on this medication. But if the person doesn't have the medication, then it means this person, one, will have a low immunity. That is an opening to most of the infections.
In 2023 alone,
The President's Emergency Plan for AIDS Relief, better known as PEPFAR, delivered life-saving antiretroviral treatment to nearly 1.3 million people in Kenya. It also provided HIV treatment and counseling for over 3 million Kenyans, supported more than 600,000 orphans and vulnerable children, and helped employ around 43,000 healthcare workers across the country. At the end of fiscal year 2024, just months before President Trump's funding freeze, more than $174 million in HIV/AIDS program funding remained undisbursed. Okutoi believes that by the government employing more community health promoters, the gap left by those affected by the USAID funding freeze will be solved to a larger extent.
The community health promoters are doing a very fundamental job, because within the community, they are the people who understand exactly what is in the household.
Imagine carrying a pregnancy and not being sure you'll come out of it alive. For years, giving birth in Turkana was almost a death sentence, bound by culture, belief, and distance.
They believe on taking their placentas back home.
But the numbers are changing and the story is shifting.
Nahakikisha huyo mama wakati anapoenda clinic amerudi at least mara 8.
The same system that once kept them away is now embracing modern care.
Any death that occurs, we do a mortality audit, and we ensure that we learn from the findings of that audit.
A care system that tends to families, culture, and even tends to their animals. Willow Health Media explores the solution saving mothers, children, men, and the lifeblood of Turkana. In the heart of Busia County, where malaria remains a deadly threat, community health promoters, or CHPs, are the frontline heroes, battling poor roads, long distances, and limited resources. They have walked miles, literally, to save lives.
Niko na household 125 na singewezewa kuitembelea hizo nyumba zote 125 kwa mwezi, na nilichukua masaa 4 kufika kwa nyumba ile ya mwisho, na ningewahudumia wateja wangu ama ningetembelea nyumba 5 hadi 8 kwa siku.
But a new intervention is changing the game. Armed with bicycles, these health promoters are now peddling the way to faster response times, timely referrals, and healthier communities.
Nafaa nitembelea nyumba 107 kwa mwezi, na kwa vile sikuwa na baiskeli, hakuna siku nilifikisha hizo nyumba. Sasa nitashukuru shirika letu la Amref kutuletea baiskeli, sababu niko sure nitakuwa natembelea nyumba zangu zote 107 na nitakuwa nafikia kila mtu kwa wakati.
Na sasa vile tumepata baiskeli, ama vile nimepata baiskeli, nitafanya kazi yangu kuwa rahisi. Nitaweza kufikia ile nyumba ya mwisho kwa chini ya lisali moja, na kazi ama nitatembelea nyumba kuanzia 10 hadi 15 kwa siku, na huduma kwa kijiji changu itakuwa bora, itaimarika kulingana na means ambayo nimepata ya baiskeli.
According to the Kenya Malaria Indicator Survey, KMIS of 2020, Busia County had 39% prevalence of malaria, which is 6 times higher than the national average and 3 times higher as compared to other endemic counties from the lake and coastal regions of Kenya.
In all my talks with them, they've been talking about 3 things. Kwanza mnataka mobility, si ndio? Pili mkasema mnataka vifaa vya kazi.
At a cost of 4.9 million shillings, Amref Health Africa, with funding from GlaxoSmithKline, GSK, and in partnership with Buffalo Bicycles, has distributed 420 bicycles to community health promoters in Busia and Siaya counties to ease movement for CHPs like Patrick Kabuko and Selifa Olukali.
Na hakuna vile tutaangamiza malaria nchi hii kama wale wahudumu wa mashinani hatuwapatie vifaa za kufaa kuhakikisha kuwa wana prevent or control malaria katika vijijini.
With wheels in motion and support behind them, Busia's community health promoters are not just fighting malaria, they are racing towards a future where every household is reached, every life counted, and every journey made easier with a simple tool, the bicycle, heading Kenya closer to a malaria-free nation.
What happens when the world gives you only two choices but you don't belong in either?
Mtoto mwenyewe akaanza kuniambia, mama, hisia zangu mimi si msichana, mimi ni kijana.
They used to give examples with me and it used to hurt me.
For years, they have lived in silence.
When they looked at my genital, the doctors and the nurse, they could not tell whether I'm male or female.
But now, they are speaking.
When I need to go for a short call, I have to go as a lady.
And when you hear their voices, you will never forget them.
We were recognized by the government. At least the government said, oh, these people do exist. And then they enumerated us.
After years in the shadows, their voices will be heard. Only on Willow Health Media.
Nigeria Health Watch is a non-governmental health communication and advocacy organization that seeks to advocate for better healthcare for all Nigerians. We are guided by the belief that health is a right and every Nigerian should have access to affordable quality healthcare. Since our inception in 2007, we have provided informed commentary and in-depth analysis of health issues aimed at advocating for better healthcare for Nigerians. We have worked to actively engage and support the government in raising awareness and increasing knowledge on a wide range of health issues in Nigeria. Our unique capacity lies in our communication expertise, using a wide range of tools including print, broadcast, and social media to enable our advocacy efforts. We have used our convening power to organize health policy dialogues, events, and webinars, bringing together policymakers and health experts to prefer solutions to the many health challenges in the country. Our evidence-based communication and advocacy has focused on health issues ranging from maternal newborn and child health, routine immunization, epidemic preparedness and response, universal health coverage, nutrition, and primary health care. We have worked with the following government ministries, development partners, and non-governmental organizations. We remain focused on meeting the health information gaps and needs of health professionals and the population in Nigeria. We are Nigeria Health Watch.
In the heart of Busia County, where malaria remains a deadly threat, community health promoters, or CHPs, are the frontline heroes, battling poor roads, long distances, and limited resources. They have walked miles, literally, to save lives.
Niko na household 125 na singewezewa kutembelea hizo nyumba zote 125 kwa mwezi, na nilichukua masaa 4 kufika kwa nyumba ile ya mwisho, na ningewahudumia wateja wangu ama ningetembelea nyumba 5 hadi 8 kwa siku.
But a new intervention is changing the game. Armed with bicycles, these health promoters are now peddling the way to faster response times, timely referrals, and healthier communities.
Nafaa nitembelea nyumba 107 kwa mwezi, na kwa vile sikuwa na baiskeli, hakuna siku nilifikisha hizo nyumba. Sasa nitashukuru shirika letu la Amref kutuletea baiskeli, sababu niko sure nitakuwa natembelea nyumba zangu zote 107 na nitakuwa nafikia kila mtu kwa wakati.
Na sasa vile tumepata baiskeli, ama vile nimepata baiskeli, nitafanya kazi yangu kuwa rahisi. Nitaweza fikia ile nyumba ya mwisho kwa chini ya lisali moja, na kazi ama nitatembelea nyumba kuanzia 10 hadi 15 kwa siku, na huduma kwa kijiji changu itakuwa bora, itaimarika kulingana na means ambayo nimepata ya baiskeli.
According to the Kenya Malaria Indicator Survey, KMIS of 2020, Busia County had 39% prevalence of malaria, which is 6 times higher than the national average and 3 times higher as compared to other endemic counties from the lake and coastal regions of Kenya.
In all my talks with them, they've been talking about 3 things. Kwanza mnataka mobility, si ndio? Pili mkasema mnataka
Nigeria
vifaa vya
Health Watch
kazi.
is a non-governmental health communication and advocacy organization that seeks to advocate for better healthcare for all Nigerians. We are guided by the belief that health is a right and every Nigerian should have access to
health economists.
9 million
So
shillings.
this is really an
Health
open
advocates
session
funding from
to freely speak from our experiences and from what we know. And we've divided it to 2 sessions. The first part, where we look at opportunities and strategies as per, the program that you have on your tables. And then the next part will be looking at the implementation challenges and lessons. Our key goal at the end of this session is, to not just talk about the problems we have, the challenges we have, but to come up with what would the next practical sessions look like, so that we're just not, feeling sorry for ourselves and all the issues that we have, but what would next practical next steps look like, so that if you are raising what you think is a challenge, what is the opportunity in there, what would be the strategy as the way forward. If you are, see a strategy, what does it look like, so that we really have something practical come from the meeting today. So Jonathan Munge from AXAM will take us through this next session. We may call a few people. It's really after that, just where you are, to tell us your name and your organization, and if it's a question or a comment. Carry.
Thank you, Dr. Korir. As she's mentioned, it's going to be an interactive session, so I'm hoping there are a lot more comments. And when we do get questions, please do put up your hand. We have a lot of technocrats in the room who should be able to assist, share some knowledge, which is part of the round table. So, as mentioned, this next session is all about implementation and challenges. I would say leaning more on lessons learned and how we can move forward after understanding some of these challenges. And I know we do have a tax representative in the room. I'm hoping Lydia is here as well. But just to set the context, Kenya loses about 100 billion Kenya shillings annually to alcohol and tobacco-related diseases. And one of the panelists mentioned our focus should be disease burden rather than revenue collection. That should be our first point of call. To make sure that we are creating healthy systems. Further to that, only about 7% of excise revenue historically reaches health programs. And that's really due to weakened systems. So maybe to kick us off, I can ask a question specifically around revenue collection, and that will be to Lydia Otieno from Customs and Border Control Department from Kenya Revenue Authority. my first question, maybe you can give us some hard numbers, is how much does KRA raise from sin taxes annually, and how much of such revenue is being ring-fenced for health financing? So maybe help us with that. Lydia, I wish I had met you in the break, but there you are. Please feel free to set the stage for us.
Thank you for this opportunity. My name is Lydia Otieno from KRA. The primary purpose is to deter consumption while also generating significant government revenue. Excess duty collected I'll first start by saying the excess duty collected in the past 2 financial years. We have 2022-2023, 68.124 billion was collected. Then in the financial year of 2023-2024, 73.624 billion was collected. We can see a rise of 8.1% with a performance of 96%. So that is what I can say for now. And about ring fencing, the revenue that is collected to increase taxes gradually, we avoid certain big jumps that create a strong incentive for smuggling. Then we have use of secure tax stamps as well as track and trace systems. Digital stamps on tobacco, alcohol, and beverages help identify genuine products and detect untaxed goods. Another point is strengthen border and customs enforcement. Just joint operations, intelligence, patrols, coordinated border management, and region cooperation reduce cross-border smuggling. Tax at the point of import and manufacturing, collecting excise taxes upstream from importers and licensed manufacturers is more efficient than chasing thousands of small retailers. Then we have tough penalties for counterfeiting and diversion. Clear enforcement and quick case handling discourage illegal production, misdeclaration and under-declaration. Thank you.
Thank you so much, Lydia. And you actually alluded to my second point there, which is we talked about leakage and how that is detrimental to the overall tax efficiency that we have. Maybe just you can highlight a bit more, because with our porous borders, as they've been described, sin taxes tend to lead to tax evasion. From a Kenya Revenue Authority standpoint, what's the best way to minimize that?
We also, the best way, we also create public awareness and health programs. Yeah. When consumers understand health risk and have support, e.g. cessation programs, there is less demand for illicit versions.
Great. Thank you, Lydia. And again, it is an open session, so if someone wants to jump in, yes.
Thank you very much. Like I said, my name is Dr. David Haoya from SEMA. Mine is just to add on what Lydia has alluded to, because I think when I worked at Kipra before, we did quite some analysis of excise taxes. And for almost 30 years, excise tax from beer was actually the leading. Beer was contributing 30% of excise tax. And if you add beer, wines, and cigarettes, it was coming to about 56% of excise tax was coming from those 3 products. And so what that means is that from the 73 billion that she has mentioned, we are looking at about 40 billion Kenya shillings, which is basically funds that we can start talking about earmarking. I thought I need to mention that, because when you put numbers behind these things, then you see what you are doing, as opposed to just saying earmarking and then you don't know what you are earmarking. Then the other thing is about the issues around treatment costs that come from diseases that we can attribute to these particular commodities. I think it will be important for us to, now that we have very nice digital devices, to try and look at what are the treatment costs for the diseases that we can directly attribute to these commodities, so that we can now see whether it adds value for us to actually redirect or hypothecate these taxes to actually go towards treating those diseases. Thank you.
Thank you, Dr. Maybe while you're there, because you do have great insight you can provide, a question I have is, if sin taxes are designed to reduce consumption, won't the end result be lower taxes as that consumption is reduced? How do we work around that to make them more sustainable?
Okay. Yeah, thank you very much. That's why I mentioned in my first beginning that there is something called Laffer curve. A Laffer curve is basically trying to relate tax rate and tax revenue. And so for each commodity, you can create a Laffer curve so that you identify at what point does additional tax reduce revenue. So if you do that, then you will be able to know for each commodity what is the optimal tax rate that you can apply. And that is very important, because what you are saying is true, that if you continue increasing without looking at the Laffer curve, where the Laffer curve turns, you may actually reducing revenue by increasing tax. But each commodity, depending on its elasticities of demand and so, has a Laffer curve, and they actually turn at different tax rates. So it's important, and I know KIPRA and maybe the other institutions that do macroeconomics have actually done, including KRA, have already done an assessment to show the Laffer curve for each commodity. And so for them, although we are talking about health as one of the priorities, for them they look at those two items, the Laffer curve and issues around the tax regime that they need to apply and the revenues that will come from there. So I think it's now time for us to bring the revenue guys in the room, so that as we discuss matters health, they are also on the table. Thank you.
Thank you, Dr. Any follow-ups on that? I would want to pose another question, and again, maybe opening it up to, if we have Dr. Riro in the room as well. Yes, Dr. Riro. A very straightforward, or at least straightforward for me, is, do sin taxes hurt the poor more than the rich?
I think it depends on a number of other factors, especially when you're looking at whether they hurt the poor more than the rich. Mainly, out of some of the things that were highlighted this morning, especially around what are the unintended consequences. So the unintended consequences is about substitution. And so if you're going to raise to a level where beer is not affordable, the alternatives, then, those in the upper quintile, adjust maybe to different beers in the same sort of market, or maybe if you're taking an 18-year-old whiskey, then you come down to 12-year-old. But I think that does not apply to the poor, essentially. So there will be a whole element around substitution that we're talking about. So potentially that could be the case. Thank you.
Thank you, Dr. Riro. Follow-up question there. Are there specific examples that you have of, I know I showed a few, and we mentioned Philippines and Thailand being those Asian tigers that have successfully managed to use sin taxes to both increase revenue and decrease consumption. Are there any other leading lights of examples of countries you know about that we can actively, as Africans, follow suit, or at least learn a bit more from?
No, I think you had a very exhaustive list, so I don't think there's any other country that I can add. Thanks.
Thank you, thank you. Appreciate that you enjoyed my presentation. It's available to you all. We'll make sure that Riziki and team make sure you get it. Perhaps moving on to something that is more health related. Do we have Dr. Ann Musava in the room? That's a shame. Maybe if there are any other. No problem at all. My question here, and this could be open to any health specialists in the room, when it comes to looking at what we grapple with in Kenya, particularly around, I would say, infectious diseases like HIV, TB, malaria, while sin taxes fund these lifestyle conditions like cancer and diabetes, how can they be designed to actually also combat communicable diseases? I know for a fact when we talk to donors, and Edwin talked about not having donors impose their views and restrictions on us, but communicable diseases, for instance, to Gates Foundation is something that's important. While we're looking at NCDs, how can we balance the two? Does anyone have a view or a perspective that they would like to share and maybe challenge the room?
Thank you very much. Actually, mine is just to share an from a current program that the NHIA in Nigeria and the NHIA in Zambia are piloting, which is the Global Fund grant to provide health insurance for people living with HIV and TB in these two countries. And so this project is actually anchored on really answering the sustainability question. With the exit of donors, with the shrinking of the Global Fund grant, how do we really see health insurance as a pathway to cover those services? Now, the marriage between the TB and HIV, which are the infections, and the NCDs, that's the non-communicable diseases, diabetes, hypertension, is happening through the health insurance. So when the Global Fund pays the premium for the HIV, TB patients, it also automatically covers him for the other services in the benefit package of the health insurance. So if a TB, HIV patient has diabetes mellitus, he can also get treated along that line. And these are programs that are just piloted in 2 countries, Nigeria and Zambia, but I know that they serve as models to really show how the infection window can be effectively integrated with the non-communicable disease window. Thank you.
Is it Rwanda? Okay, Rwanda has been doing that for 15 years. Okay. Through the Global Fund, yeah. We had Robinson, who had something to present. Robinson is a researcher. His PhD was on this topic that we are having a conversation on. I've been waiting for him to raise his hand. Jonathan has even walked that side, and he's been very quiet. So the floor is yours to tell us what did your research show, or what did you find that would be useful to the room or to the people here, or did they say everything that you found? That could also be another thing.
Thanks very much. I think I'll speak a little bit to the work I'm doing currently on excise taxes on tobacco, and the framework that I'm using in this analysis is to really show the distributional impacts of increasing excise taxes on tobacco at different thresholds, from 25% to 50% and to 75%, and of course to see how this impacts on various socioeconomic groups in terms of the health gains, in terms of the catastrophic health expenditures averted, in terms of the revenue generated. So while this work is still ongoing, I think what has been the conversation in this room is the findings really mirrors to the kind of conversations you're having in this room. So firstly, the question of, well, the poor who are suffering more as a result of a fiscal policy decision. From our analysis, we can see that, of course, given the consumption of tobacco in the country, based on the STEP survey for 2015, we can see that in terms of the share of, in terms of now the contribution across the wealth quintiles, which socioeconomic groups are contributing more, we can see that, firstly, given the prevalence of tobacco smoking, this is just the findings I'm speaking to based on the first year of analysis. So if the policy was to be implemented across those three thresholds, we'll see that the poor seem to be contributing a higher share of that tax. But I'm planning to do a simulation model over 50 years to see how that will change. Nonetheless, if you look at the catastrophic health expenditure averted, we looked at 4 health conditions that are associated with tobacco smoking. We found that in terms of catastrophic health expenditures averted as a result of instituting this tax, it's the poor that benefit the most, right? So in that front, at least, we can see the distributional impacts. Then, of course, in terms of revenue generated to the government, as we would anticipate, the higher the tax, the higher the revenue. Consistently across those 3 thresholds, we saw that the revenue that is being generated is, I may not speak to the figures unless I look at my slides, but overall, the revenue generated in the first year is quite significant from the 3 thresholds, of course, the 75% yielding the highest. Yeah, so I think those are just the snippets that I can speak to, given the work that I'm doing on tobacco taxation in the country. Thank you.
Thank you so much, Robinson. You're lucky you didn't have to present your slides, but I'm sure we would want to see them later. Maybe to check with the people online, I'm sure there may be some questions. So maybe the team helping us with that can check how we can make sure we involve the people who are joining us online and have them contribute. In the meantime, I want to pass the mic here.
Thank you very much and for this support and all that been said. The truth is that we are health financing, but I actually expected the regulators to be here because looking at the health aspects cannot really exclude this set of people from this kind of, because directly or indirectly, their work influences the financing aspect, because the burden increases and continues to increase as far as the regulation is not well strengthened. Because it can gather as much fund as it can, but if that regulation is not there, the consumption is not curtailed, the burden continues to increase. If you come to, in Nigeria, from most parts of the suburbs, most of these things are being hawked and nothing is being done about it. They are being hawked and these hawkers are doing their businesses undisturbed. This consumption is being done everywhere, in the open, and nothing is being done about it. And all of these things are not really what we are here talking about. They are not cigarettes, they are not beer, they are not wine. They are substances that are very dangerous to health. Mixtures, concoctions, because these youths are being very innovative with these things these days. Most of them cannot afford these products that we're talking about. And we keep talking about increasing taxes and getting revenue. Is it really about health or is it about revenue generation? If it is about health, these same people we are trying to protect are being subjected to more dangerous situations. They are being subjected to more health harms than we think. Because it is on the increase. Even in our secondary schools, children consume most of these things and nothing is being done. These taxes we are talking about is just on few dozens of legitimate companies, sorry, excuse me, and companies out of thousands of illicit producers, traders everywhere. So we cannot talk about financing without talking about the regulation and the enforcement because it's on the increase. When we talk about, because all of these problems will still be centered around the same thing. You say industries fight back. Yes, they do. I will speak from the industry's perspective because I relate with them directly. When taxes we are talking about, it has a direct indication of what's happening. Actually, they are legitimate business people that comply with everything. Their business environment, the quality, the standards, pay taxes, everything. Yet the government seems to look away from the problems and they are just punished. It now looks as if they are being punished for being legitimate in their businesses. And the illegitimate ones, their businesses have been lucrative, yet they don't generate anything from them. We have so many unbranded substances, you cannot trace them, and they are being sold in the open. With 200 naira, they could get concoctions that can get them very high, and these are the very dangerous problems. The problems that we should be addressing. Have you really taken impact assessment on all these strategies that we have been using for long? And he talked about this tobacco tax being on the table for more than 50 years. Why is it so? Because you've been doing something for a long time and you have been able to assess the impact and why it's not working. It's not working because we are actually leaving the main thing and we are busy chasing the other minor things. And this revenue that is being generated, what is it used for? These few individuals pay actually, and they pay heavily for sins that they are not just the ones committing it. We don't have to shy away from the real truth. I expected NDA to be here. I expected NAFDAC to be here. I expected all these regulators to be here because this issue centers around them. We seem to look away from these aspects. The implications of this health taxes we are talking about is that doing this, just as I said, it's just a few dozens of these people. Like in Nigeria, he talks about beer sectorial group. Beer sectorial group is just made about 3 companies. A bottle of beer, from what they say, is about 1,000 plus. And the alcoholic content of beer is just 5%. The alcoholic content. When you tax the beer the way you tax maybe other alcoholic products that have up to 40%, you know they will react. Because one would rather go for the higher content than the bigger one while taxing them the same thing. So that is, on this aspect, they were actually advocating for or rooting for taxation. We tax according to the content. I believe that we are now beginning to understand this, and even Nigeria is towing that path. When we are doing this, there has to be a concrete strategy on how to regulate this. Because the illicit ones are becoming very lucrative. Nobody is going after them. If manufacturing ecosystem, these are the ones that we can actually regulate what they are doing. We see them. And the more you do this, you even shift the revenue because the manufacturing output comes lowered. And the other illicit sites becomes increased and you cannot get anything from there. And people would naturally go for what they can afford. So I think that we should actually look at the men. while we are addressing this, we should also be looking at how do we curb all of these things so that it does not escalate. Thank you for now.
Thank you so much, Joy. Great point on the illicit industry. I think in Kenya it accounts for about 30 to 50%, Nigeria about the same. I know enforcement is important in that aspect, but I do want to give the audience some time. There was a gentleman here, but ladies first, and then we'll come back to you.
Yeah, sorry about that. So mine is a little bit different. Coming from the CSOs, we've learned how to keep our mouths shut. I will tell you in a second why. Do we have anybody from the tobacco industry in the room? They were invited, they didn't come. Anybody from the alcohol side in the room? I'm going to get to that. Good question. But we do have the Ministry of Health, right, who was represented. Ministry of Finance. Care is here, right? So what we've come to understand as CSOs is the fact that if not all the players are on the table, we cannot start doing our lobbying and making noise because it becomes a little bit unfair, right? And I think that's what the lady was trying to make that point of, we are picking one side and leaving the other. But do we have consumers of alcohol and tobacco in the room? Do you want your alcohol to be increased in rate? Let's be realistic. Do you want them to sell it at 100% the Chardonnay wine you drink? We need to be a bit realistic, right? So, and we're talking about aid dependency, and I wanted to direct this question to the Ministry of Health. The MOUs by the United States government are being signed, and they are all literally running towards the MOUs. We're talking about domestic resource mobilization. They are going back to aid dependency, right? CSOs, we've been locked out because we're trying to tell them, hey, after USAID, we've learned our lesson. We want to finance our own health. But they are running towards signing the MOUs. So I feel like at the end of it, what we've come to realize is, the way Edwin mentioned, you need to know who your buddies are. And we've been reduced as CSOs to knocking doors and saying, hi, buddy, you remember me from last year? We had this cocktail, then we had this meeting in Unga, and blah, blah, blah. When you're signing, could you make sure that if there's a committee, there's a voice for CSO, just call me, knock my door, I'll be more than happy. We've gone back to begging because they've gone back to signing other USA deals, yeah? So we need to be a bit realistic. We're more than happy talking about aid dependency. We don't want it. Everybody in the room doesn't want, right? But the government people are not here because they're busy signing those deals. It's the Ministry of Health, it's the Ministry of Finance, Ministry of Education. They are all in rooms locked and discussing deals that are going to cost us the next 25 years. And we're still here talking about, hey, let's do tax on tobacco, and it's not priority for them. So Edwin, it goes back to priority also. I know you said, it's a fight. We're starting now, but it could be something we win in 70 years because for them, they've seen the gap by USAID. They're seeing the gap being affected by PEPFAR. 11 billion is not the target for Global Fund. And as ENASO, we're handling the Anglophone and Lusophone aspect of Global Fund. Their target is 18 billion, right? They've raised 11. And we're still trying to figure out how much will we get from the 11. No government is talking about, hey, let's go back to domestic resource mobilization, Carrie. And I was excited about her figures. It went up. My question is, what do you do with all that money? Because you can give me mine. I can pocket that and help myself. But it goes up. That means we are more than capable of taking care of things like health. And what I like is the fact that health has gone back to, in Africa, this is the only time I've seen the whole continent talking about money. Because Trump yapped it out. But Trump is coming back and saying, hey, it's back. All you have to do is sign. And they're doing it. So we also need to figure out priority-wise. Is it priority for the government to look at tobacco and cigarette guys? It's not, right? Let the alcohol be 20 shillings or $200,000 because it's but we need to be a bit realistic. This is good. And we normally keep quiet because we've got to understand that we're told CSOs we make so much noise, but we've realized we've gone back to knocking doors and saying, remember me, I'm CSO. We've been put back in our place where this was like 20 years sort of discussion. Okay, sorry.
No, thank you, Lizzie. That is important. And to your point, no one is talking about it. We are talking about it right now in this room, about the importance of domestic revenue mobilization. I know AFIA does. I know it's important to Willow and Nigeria Health Watch. So we are on the right path. I do want to give the people online a chance to ask, so I'll hand over to the tech team to pose that question, and then I'll come to you.
Hello?
Yes, we can hear you. Go ahead.
Okay, thank you so much. I just want to make two clarifications. One is that tax is one of the biggest tools of controlling consumption of products of health concern. It works. Taxation has worked in tobacco control. I would also want to say that this is not a new conversation at all. The Framework Convention on Tobacco Control, we just ended the Conference of Parties, and the MOP on illicit trade is going on currently in Geneva. The FTTC celebrated its 20 years, been on for a decade, and has a very clear provision for countries to take measures to use taxation to reduce consumption. It's not because Donald Trump suddenly came and full of you say that this conversation started. It's because it is the right thing to do. Governments have been holding conversation about how to use taxes to reduce consumption of products like salt, sugar, alcohol, and tobacco. Now, I also want to point out that in production, corporations need to pay for the total embodiment of the cost of production. And when you're looking at the cost of production, it implies that you must look at the impact of that product on planet and people. And that leads us to what we call the polluter pays principle. What we're basically saying is that government, you need to look at how this production system, this production mechanism will be able to pay for some of their impact on people, on people's health, and of course on the environment and on the climate. We've seen statistics over statistics in terms of the impact of this consumption on the health of our people. There are discussions about whether even tobacco should be banned. There are the end game about stopping production of tobacco completely. While some people believe in losing demand and demand and supply mechanism where taxes falls in to reduce consumption. And that's why we think that looking at the industry narrative, countering those narratives, money not spent on alcohol or on tobacco is not going to be thrown into the sea. There are a lot of economists that are listening to them in the room. They know it doesn't really work that way. And that, looking beyond some of these industry narratives, taking both steps by our government to ensure that the health of our people take primacy is extremely important. Thank you.
Thank you very much. We are running close to time. I did want to invite this gentleman here to ask a question, and then maybe to Boniface from AMREF. Boniface, I'll put pressure on you. Maybe at lunchtime you can socialize the team in figuring out how do we ensure that money collected from sin taxes is actually diverted to the correct health outcomes. So perhaps when you see Boniface at lunch, please quiz him on, make sure he gives you a good answer to that, so that he also has a chance to speak on that.
All right, yeah, thank you very much. And my name is Michael Olanio. I work with the Campaign for Tobacco-Free Kids. So you can guess that tobacco control is my bread and butter, really. I just wanted to clarify something. You see, when we talk about the other problems, the other that people will move to, whether we raise tax or not, they will consume those other products. That is one. There are two separate conversations. The problem of implementation is a different conversation. And when we begin to mix them together, we will not make a headway in any. We have to separate them. The issue around tax increase, around illicit trade in tobacco, in sugar sweetened beverage, alcohol and the rest, are big enough. See, there's this thing that the philosophy I always, when people ask me, why do you do tobacco control, why not drug abuse and the rest? I say, I deal with what my hand can handle. I don't take up all the problems because then I would be overwhelmed. What we can deal with now is tobacco tax increase, earmarking, alcohol tax increase, and the rest of them. Those are the things we can handle right now. The conversation with NDLEA in Nigeria, which is the Drug Law Enforcement Agency, NAFDAC, on the unregulated sector, that has to do with enforcement. We take that conversation to them, and it's happening already. NDLEA is already doing a lot. The problem is so humongous that what NDLEA is doing seems little, but if you look at the overall volume of enforcement that has happened in Nigeria, you will find that they are doing far more than they were doing in the past, which means there's been an uptick in enforcement. NAFDAC is doing so much more also. Are they doing enough? No. But are we also doing enough in terms of tax increase, in terms of earmarking? The answer also is no. So we must do the two at the same time, not to leave one for the other. Now, the conversation around tax increase, I just want to clarify that tax increase, particularly for tobacco products, is not a 70-year-old conversation. It's a conversation that started about 10 years or less. The FCTC is 20 years old. That is the Framework Convention on Tobacco Control. And I'm sorry, my bias is always going to be towards tobacco control. I can speak confidently about what I know, not so much about alcohol and the rest. And the conversation around tax increase is less than 10 years old. And already we are seeing results in some countries that are doing tax increase, that have done earmarking. So I think that the question of whether we should increase tax or mixing the conversation should not even arise at all. The issue is we need to increase tax. Then I also want to close with a saying that you don't tell a man not to buy a car because there are armed robbers around him. You don't say, oh, look, there's so much insecurity, therefore don't ride your vehicle. You know, it is one thing, I must do what I need to do to protect the people as far as I know. Illicit trade will always be an argument, right? But that is for customs to deal with. We need to strengthen the systems that regulate illicit trade. Kenya is doing a fantastic job with tax and track and trace. You know, we have countries that are doing a lot to curtail illicit trade. We will not stop tax increase because we are not doing illicit trade. We will do the two together. There's this saying that I always refer to. I sweep my corner, you sweep your corner. If you fail to sweep your corner, then I have a duty to prevent your dust from coming to my space. And that is the challenge to the government. We will raise taxes in country. The fear of illicit trade then puts a responsibility on us to ensure that those products that are not properly taxed from other countries do not flow into my country. But if I do that and I raise taxes well, and you raise taxes well, where are the cheaper products going to come from? Thank you.
Thank you, Michael. Appreciate that. I'm going to hand over to Boniface. Doesn't want his lunch ruined, so we'll give him 2 minutes just to respond to my question. And specifically, it's how do we ensure that revenue from sin taxes actually flows to priority health programs?
Yeah, so there are a couple of things that we need to lay on the table. I think the first thing to remember is that the preoccupation is not only on the sin taxes, but larger on the bigger pot of taxes and ensuring that they are being directed towards health. Because if we only narrow it to sin taxes, then the conversation becomes harder and harder. My other consideration that I would want us to think about is, do government or are government even prioritizing domestic financing as a government strategy? And this is an important conversation because in Africa we suffer from a problem that I would call just lack of agency, even when you know what needs to be done. And so we need to keep asking ourselves, how can we make domestic financing as a broader conversation that governments must be able to apply? I like the civil society colleague who has been able to bring us back to the fact that maybe it is not even a priority. And we need to keep having those kind of conversations, because if our health is still going to be financed by external people, when will we develop the African health system? There is no way external people will develop the African health system. We must build the African health system and ensure that it responds to the day-to-day problems that our people are suffering from. If you look at the example that was given about Philippines, they did not wait for USAID. They went back to the fact that they could be able to raise some sin taxes, and they directed it to a need that they were able to identify, and ensured that they even put it in law, so that there is a sin tax law that protects those resources to ensure that it goes directly to what they intended it to be. Many of our countries don't have policy instruments that are strong enough to ensure that what they intend to do is put in a mandatory state. It cannot be that it is a good thing for us to have. It must be the thing to have. And we must be able to look for a way that as stakeholders to ensure that our governments are putting actions to some of the promises that they make. All our countries have said that they want to be able to prioritize domestic financing. There's a whole Africa leadership meeting that was held for a number of years. There is the Abuja Declaration. Surely, we must just get into action, and we must be able to pull together all these people. The last thing is to be able to remember that financing health is not just a health responsibility. We must be able to bring the revenue authorities on board. We must be able to bring the health, the finance teams on board. We must be able to bring the trade people on board. Because all these things, if we're not bringing everybody on the table, or rather if we're not making effort to ensure that we are speaking with one voice, it means that what one is doing is undoing what the other one is doing. And that means that it will lead us to a point where we will not be able to get to achieve goals that we are seeking. And so it is important to remember that the African health system cannot continue being funded by external people. We need to regain our sovereignty by financing our health system.
Great. Thank you so much. Thank you so much, Boniface. I think that's a good point to end. We do have to move on. And at this point, I do want to hand over to Vivian, who will take us through the next session.
Okay, I think it's been a very robust discussion, and I know that this session is what is keeping all of us between lunch. So we'll keep it as brief as possible, but also as interactive and as engaging. I think the previous sessions have covered a lot of the issues that I think we came here to talk about and discuss. But this is really now finalizing and just talking about what we know are the often implementation challenges that we face for all the different countries. Sometimes the challenges seem insurmountable. So this is really drilling down on what are those challenges. And I think the biggest elephant in the room, and one of the biggest elephants in the room, is in as much as we're having this discussion now, we know one of the most powerful agencies or lobbies or people who are against any form of health taxes is industry. So I think it's really important that we kind of hone in and really bring, I think, surface some of those discussions here. So I'm going to kick off really by trying to set that context as the framework through which we'll have this quick discussion. And I think some of the points that I think Joy raised are a good segue to really unpack some of the things she highlighted, which is, it seems that we're almost penalizing people who abide by taxes, they pay their taxes. Why are we focusing on them? But you're very right, Joy, the regulation is very weak in many of our countries. We talk about who is responsible for regulating the sale of unsafe alcoholic products. Recently, NAFDAC banned the sale of small alcohol sachets, because in Nigeria, you can actually buy small, when we talk bottom of the pyramid, many FMCG companies are sort of going down the route of selling small packages of soap powder, milk powder, but even we have alcohol that's even sold in small sachets to make it, quote unquote, more affordable for those at the bottom of the pyramid. So NAFDAC, who's our regulatory agency, has recently stepped in and is looking to ban, but you're very right. Regulation, I think, is multi-sectoral. There's no reason why Coca-Cola should be sold in schools. Those are things we don't even think about. So I think the enforcement, and I think this is a discussion that we maybe need to surface and have with some of those regulators to really highlight some of those issues and how we can surface them, but also, let's not forget, education is also very important. So I'm going to really start by looking really at the private sector through that lens. And I know one of the organizations we have in Nigeria, and I think you have a similar one in Kenya, is the Healthcare Federation. So we have our Healthcare Federation in Nigeria, we have Healthcare Federation of Kenya, and I think other African countries have similar. So I want to ask this question to someone who's online, who's been very, very patiently waiting. Njide, are you still online? Yes. Can we hear you? Is she online? Can we see her?
Can you hear me?
Fantastic. Can we also get a visual? Njide is the country. Hi, Njide. Good to see you. And thank you so much for staying on. I know it's been a long day, and it's really good to have you here. Njide is the country director for Farm Access. I think you all know Farm Access. But she's also the president for the Healthcare Federation of Nigeria, which is one of the, I think, private sector institutions that is really working hand in hand with our Ministry of Health to really ensure that the role and the importance of the private sector is really integrated into our health systems. And we're really relieved, I think, that we actually have a current administration, at least through the ministry, that actually opens up and actually understands the important role of the private sector. So really asking you first, because I think also we have Anne Musuwa, who's here in the room. She's back. Okay, she is the Healthcare Federation of Kenya director. So, Njide, for you, what role do you see private health sector playing in supporting credible health reforms and helping counter industry narratives that really undermine public health?
Okay, thank you very much for this opportunity. I've been listening since morning, so a lot has been said in the room and pretty much well captured by all the participants. But what I didn't hear is, first of all, the implication for private providers. And I think that is where, I see a lot of collaboration. So the Healthcare Federation of Nigeria, which is similar to the Kenya Healthcare Federation, has been championing policies. In fact, we were on the forefront of advocating for these SSB taxes right after COVID, Vivian, if you remember, together with the World Bank, because at the time, resources available to countries dipped, and there was now a focus on local resource mobilization. We campaigned and we had a lot of engagements, and eventually it was near being passed, but then there was a complication of, it goes into the larger court, so it's not really ring fence for health. And that is another discussion that needs to be had. At the time, the case was made around the fact that there's the percentage of people who could not afford to pay for themselves, the people at the bottom of the pyramid, who are largely the consumers of some of these, alcohol and cigarettes, were often left out of the health system. So we needed to raise funding to add to cover them, the health equity fund or the health insurance packages. So sector has been really on the forefront. One, from the point of view of making those resources also available to strengthen the healthcare system. How do we ensure that it's channeled? So we remain resolute in terms of policy adjustment, designing those policies with government, and ensuring that there's transparency around how that money is spent. If you were asked to give government your money, you'd probably say no until they show you how they're going to spend it. So transparency is extremely key. Secondly, is really around education. I heard someone talk about prevention. Oftentimes we're curative. We don't pay attention to the education part of it. I think private sector can really play a huge role in that. Again, the numbers out there in sub-Saharan Africa is that over 70% of care in the healthcare system is provided by private sector. So these people that fall ill, they end up in the hospital, they can't pay their bill. And oftentimes, I know that a lot of hospitals in Nigeria run at a loss because patients are not paying. Even when they pay, it's not adequate and so on. So I think the focus is on us actually to quit talking and begin to sit around the table to design and implement what works. I heard Mr. Tayo Oyedele when he spoke. And I think that some really good efforts are being made in Nigeria. So for us, I think private sector really needs to, be in the room with the policymakers, be able to implement, be able to, show some critical data around how this also, affects the private sector, the private providers. Also provide data in terms of the costs to the healthcare system. So I think that, we still have a huge role to play, but we need to be invited into the room to help support with the policy interventions. Over to you, Vivian.
Thanks for that, Njide. And actually, if you don't mind, I want to just segue and just pick up on something you mentioned, which is the education part. We know that a lot of healthcare in Nigeria and other African countries is through the private sector. But one thing we don't see enough, and I stand to be corrected, is the private sector being at the forefront and playing that role in preventative health. We know there is a big push at the ministry to talk about health promotion, but given the important role of the private sector, what role do you think HFN and similar industry bodies can really play in having a collective campaign around health promotion?
Awesome. I don't know if you are aware, I don't think you were in the country, but the private sector has now been included in the UHC Compact. This compact, for those who don't know, is a document, kind of an MOU that was signed between all the governors of all the states in Nigeria. And for the first time, private sector is included. So, and this is not just focused on providing care, but also how do we ensure that our communities are well educated? How do we involve the providers, even into holding the community members into a health insurance scheme? So I think this is an opportunity for us. We are going to take the next steps to design the activities around that, and definitely it will include education around preventative, how you need to take care of yourself before you come into the hospitals. And as you well know, we have, the Jackpot syndrome, as they call it. Half our medical professionals are leaving the country because of the economic situation. So we find that digital tools and all other task shifting are taking hold. So these are some of the things that we need to do to prevent people from getting into hospital, ensure that they're well educated, the environment is clean. We talk about One Health and so many other initiatives that will prevent rather than wait for people to get into the hospital to be treated. So again, private sector has a huge role to play. And when you talk about private sector, that includes our patent medicine vendors, community pharmacies, the non-traditional healthcare providers are neglected. I think that we are now recognizing the big elephants in the room and trying to make sure that our activities include some of these care providers who are often not recognized. So, we are going to use all channels available through the Healthcare Federation, which interestingly is made up of associations of almost all the private healthcare providers, including community pharmacies, pharmaceutical manufacturers, HMOs, private healthcare owners, and so on and so forth. So we have a huge community that we can leverage to support government in preventing rather than curating. So let's see how the next year pans out. We just signed the compact 2 weeks ago, so we're now set to to get it swing into action from private sector perspective.
Thank you very much, Engineer.
Response, and I think it's really commendable how much HFN has managed to do, and I think would have been good to also hear from the Kenya Healthcare Federation, but that's okay. We hope to hear somehow through some of the comments from other people. I'd like to now move to what we talk. We're talking about the elephant in the room. Some of these industry common tactics that are used to delay or weaken some of these health tax policies. And I think, Michael, you sort of started that conversation. But just to further that, we know the lobbying power of industry, which is understandable. We saw that matrix that was shared about what organizations like Coca-Cola have been doing. So, but the government also plays an important role in countering that. I'll never forget how, I think it was pre-COVID, Coca-Cola came to Nigeria and signed or had some agreement with the vice president then that they were going to invest, I think it was 5 billion naira or something, in Nigeria. That never quite materialized. But you can imagine how it's very easy for Coca-Cola to go to a legislator and say, listen, I'm going to build a plant in your town and do X, Y, Z, or other industry. And it's very easy for governments to kind of, cotton on to that for the simple reason everybody wants to, increase the economy, but also looks at the employment implications of a lot of these multinational companies. So, but even having said that, how can the government effectively anticipate and challenge some of these common tactics? If you don't mind, Joy, let me ask you that question. I know you were talking about the regulation part, so just want to hear from you and then open it to other people. How can government most effectively anticipate and challenge the common tactics that industry use to delay or weaken health tax policies?
How can government,
How can government effectively anticipate? Because we know it's coming, but so how at Ministry of Industry and Trade, how do you challenge when you hear the counter arguments from industry?
Okay. Number one, once we hear this as industry, everyone tends to protect his own, right? The gentleman here said, if I sweep my house and you don't sweep your own, it won't stop me from preventing the dust from coming to his house. I looked at that as, if he had, imagine a scenario where he had planned well with the neighbor to say, let's sweep these things together at once and then save me the costs and the energy of going back to protect your dust from getting into my house. So, and that speaks to collaboration. And even when you say industries are actually fighting back, my ministry usually stand in the part of the industry, not because we are in support of the impact of this alcohol. Truth be said, we don't even consume it. Our children don't. But what we just want to do is let things be done in the right way. If we want to fight this, let us fight it holistically in a way that there will be a balance. If this is a legitimate business, let it be a legitimate business, and let us not victimize or frustrate them. Because even if you ban it, it will not still solve any problem. Marijuana is banned, yet the consumption is on a very high rate. So we are talking about how do we mitigate this? One way to mitigate these challenges is, I've talked about tiered taxation, and this stands as a kind of incentivizing the reformulation of these products. When you say lower your alcohol content and then pay lesser tax or excise, at least that is a way of encouraging people to at least reformulate these products. Instead of telling me that no matter what the alcoholic content or the sugar content, all of us will pay the same thing. So if we have a tiered taxation, I know that it will encourage people to say, okay, let's do better. And again, I've talked about collaboration. That collaboration is very, very, very key, because even to get these industry players to comply with all of these things, you need everybody, all hands to be on deck. It's not just about health issue. All of us are working towards common goal. Because as much as we cannot stop the influx of substandard, and it's not just about across the border, even locally, some of these things are being produced at the backyards, everywhere. So there is the need for us to look inward and see how we can help mitigate some of these challenges. And again, if it's the much I know, these industries, they don't really try to avert taxes. They are compliance, but the only problem they usually have is that our price continues to grow and patronage is going down. Our companies are folding up, yet nothing is being done on the other parts. Because the more their prices are going high, the consumption of the other cheaper ones are on the high rates, and their own output is very, very low. So it becomes a problem to them. We can't continue to be victimized. We can't continue to be compliant. We carry the burden of every other thing, cost of production and paying taxes, yet we carry the whole burden. Again, so another way to mitigate this thing is, I have talked about also prioritizing impact. Let us be looking inward to see if what we are doing is actually working or not working. And also transparency, all of these things have been talked about. And if you look at this whole thing, these domestic industries that's actually producing this thing, the advantage that we have is that we look at them, we tell them, we give them guidelines, we regulate their activities, their environments, their formulations, everything that they are doing. And if we don't make the business environment at least conducive for them, we deindustrialize, and deindustrializing them will not still stop the consumption of every other substances. So this thing keeps occurring, and if serious attention is not being paid to all of these things, we will continue to lose revenue. It's not going to be a win-win situation, because you continue to lose, yet you will not make much.
All right, thank you for that. Thank you for that. So are you going to make another point? So you okay, no, conclude, sorry.
Most of these things have been said, and another thing is also very important, sensitization. Yes. And these industries are really, really ready to work with government. Most times they see them as enemies. They don't want to work with them freely, because these people actually know how to fish out some of these people, carry a campaign intensively against consumption, and do all sorts with the government to ensure that their own businesses are not being truncated. So these are some of the things. Most of these things are mentioned anyway, just to show that when we are making all of these policies, let's not just be about revenue. Let us consider the health impact, the impact of this on the public health and also the industry balance, so that it will be effective and the people paying these taxes will also pay it with joy, knowing that, yes, what we are doing is working. But if it's not working and it keep still giving them all of this, it's not a good thing. Mind you, if these companies are being frustrated, the environment is not conducive, and youths are losing their jobs, you end up throwing more people into the same habits that you're trying to protect them. And also, when we are talking about these companies having lowest rates, we should think about other business environments there. There are multiple taxation, there are insecurity challenges, there are infrastructure deficits that they all have to deal with, and this regulation lapses. And in some of these countries where the taxes are high, perhaps they have explored every other factors, and what is left is the tax, which is why it will work very well. But as far as these other area factors are not being taken care of, and you still add tax to it, it's not just that tax that you're looking at that they are paying. There are so many several other ones that they are paying that you do not know. So all of these things makes it very, very difficult for them to survive, and if they don't survive, even the nation itself suffers more. So that's where we stand, and that's what we think, that if we do these things collectively, these problems will be tackled holistically. Thank you.
Thank you very much for those comments, and I think you raised so many that I was trying to remember. Okay, let me go back on that. But I think one thing we are hearing and we are very aware of is, I know back when the Finance Act was passed in 2021, one of the biggest pushbacks was, the challenge of job losses and people being quite strong in defending the use of health taxes as a way to disincentivize. I mean, let's remember, what they're trying to disincentivize is the consumption of alcoholic drinks, cigarettes, sugary sweetened beverages. And given the rising incidences of non-communicable diseases, which is going to surpass infectious diseases, high blood pressure, hypertension, the health argument has to be the top one. So what is the financial cost of treating someone with hypertension? What is the financial cost of treating somebody with heart disease? That's where that finance cost comes in. And it's a delicate balance. How do you weigh up the industry, job losses, whereas the long-term implications of a lot of these unhealthy drinks? And let's remember, by and large, the people who consume them the most are often, especially in a country like Nigeria, people on lower income. I know I've seen people drink Coke and have Coke and bread for lunch. And we know that's often a cost reason. But the question, though, is, should we incentivize healthier consumption than disincentivizing unhealthy consumption of products? I think it's a delicate balance, and it's one I think all countries are struggling with. I think for many other countries, what has happened is the formulation has changed. I mean, you go to, let me just say, countries in the global north, let me use that word loosely, and I can tell you for free, the level of sugar and others in drinks is not what we have on the African continent, and you have to almost ask why. But I think we can also look at how other industries have tackled it. I think, Michael, you mentioned the Framework Convention on Tobacco Control. So learning from what was done there in having tighter regulation against the consumption of cigarettes. I mean, imagine once upon a time you used to be able to smoke on an airplane. It's hard to remember that even being possible now. What lessons can we learn from what was done in the tobacco industry in an area like the sugar-sweetened beverage industry, which I think is probably one of those areas which is could potentially be a bit harder to convince people why we need to tax those drinks? Yep. This is a microphone.
Thank you for this opportunity. So the FCTC, the Framework Convention on Tobacco Control, as you're probably all aware, is the first global treaty negotiated on the platform of the WHO. The lessons learned are so many. Perhaps the biggest one is to contrast what is happening with the FCTC and what is happening with climate change. There's an Article 5.3 in the FCTC. I'm not to bore you with all the details. It simply means to avoid tobacco industry involvement in policy making. And what is happening with the climate conversation, you'll find the industries in the room for climate, and it's not moving. And then it's about control. The industry is not in the room, and progress is being made. So that's one key lesson. That is not to say that you do not engage at all. Article 5.3 of the FCTC says that you can engage for the purpose enforcement, implementation, data collection, and at the point of regulation, after you have drafted, you can take their input into it, I would say, for a balanced view. That's one key lesson that we can take away from the... It seems even worse. All right. TC. Oh.
Just try one more time. Just try one
Oh,
more
okay,
time.
yeah. The second thing is the FCTC creates a platform for country learning. And so the industry would come to you and say, oh, do this, because nobody is doing it. One of the FCTC conference of parties, we know what everybody is doing, and then you can take lessons from that. And let me just run back to the first question about what are the use and how can you preempt and prevent them. That what we find in no control is that the tactics are almost the same. Essentially, one is people are going to consume products. I think I've made more changes than a football coach. The first is people are going to consume alternative products. That's an argument that is valid. Like I said earlier, we will stop doing what we need to do because of that. What we need to do is address that. Second argument has always been illicit trade. Or if you tax us high, people will bring these products in, unregulated products will come into the market. Yes, it's also valid. Not as, it's usually more exaggerated than the reality. Like in tobacco control, we have found that it is the legitimate companies that produce the illicit products, the unregulated ones, because tobacco production, tobacco cigarettes are highly mechanized. And that takes me to the third argument, which is unemployment. We've done our research, we've gone to the British American Tobacco Factory in Ibadan, in Nigeria, and we found that there are less than 100 people working in the entire factory. It's a multi-billion-dollar factory. It's highly... When the industry tells you, oh, people are going to lose jobs, they're actually referring to the man by the street corner, everybody in the value chain, exactly. So what the government needs to do is work with people in the value chain also. You don't just tax them and shut them down. You work with them also to provide alternative livelihood like we're doing with agriculture. I know Kenya is doing something like that in tobacco farming to transition to alternative products, alternative farm products, so that they don't lose money. Another argument is it's anti-poor. Oh, when you raise taxes, the poor cannot buy it. But the reality is that, like the gentleman, the researcher here mentioned, the benefits for the poor is even far higher than whatever pain they're going to suffer in the interim. Then we have issues around revenue. Oh, if you raise taxes, you lose revenue. The government loses revenue because people do not consume these products. It also means the government does not get to pay for the health costs, right? So those are kind of counter you can have for the industry, and they are going to come, and they say the arguments are the same. It may come in different languages. It may come in Swahili, it may come in English, it may come in French, but it's essentially the same. There are just 7 of them. And we've heard them over and over again, and we know now what to say to counter them. Of course, there is the argument around litigation. Oh, that's usually like the last one. We're going to sue you. It's against the World Trade Organization. It's against the TRIPS. It's against the TRIPS, like I say jokingly. It's against TRIPS and traps. They're going to come up with all of this, but we need to be prepared with answers. And what are the answers? The answers are, 1, you need to reframe it correctly. We can't just sit back and say, because of those challenges, just disregard the challenges. You must be able to reframe it and talk about it. So when we talk about data, one of the challenges we've had in tobacco control, I'm sorry I'm taking so much time. One of the challenges we've had in tobacco control is that, we do big data, we collect global adult tobacco survey, global youth tobacco survey, but what does that mean to the man on the street? Because at the end of the day, it's the man on the street that determines the political appetite of the politician who is going to implement the laws. So if the man on the street is in support of tobacco tax, in support of SSB taxes, the government will follow, right? So we need to translate that data into little bites that the guys on the street can understand, and then we need to bring diverse voices. And I can go on and on. I'm going to stop here. Thank you.
Thanks for that, Michael, because my next question, ironically, was actually to you, Aminata. So I just want to use this to sort of close out the discussions to Aminata and to Lizzie. And that's more on the other side. Somebody was asking who would want taxes on our alcohol. I think all of us in this room are consumers of SSBs, alcohol. I don't know how many of you are smokers. I think probably not as many, but I'm sure everybody in this room drinks Coke, Fanta, Sprite, wine, but maybe, I don't know, segue, how many of you would be happily feeding your children these drinks? As in, the education part, I think, is lacking. So I think on the consumer side, which is where I want to probably end, because, as Nigeria Health Watch, this is where we are, and I think Dr. Musa Omale gave us that challenge. How can civil society and community groups really build trust and counter misinformation so that health taxes are not seen as protective rather than punitive? Aminata. And then Lizzie. And then maybe I'll end on you, Edwin, because you talk about knowing our reality, the context. So maybe the context of the communities and consumers. We can end on you. Thank you. Okay. Maybe try mine.
Is it working okay?
Yeah,
okay. Yeah. I'll just speak a bit closer. I think it dips in and out. I just wanted to build off of what you were saying in terms of reframing and then come to your Vivian. When I was looking at the title, Unlocking Domestic Health Financing, I think when we talk about domestic health financing, especially on the continent, populations are funding our health, whether it's a family member funding like an aunt funding their niece to go to the hospital. When we really talk about domestic health financing, I think reframing the message to the average person is how do we ensure that it's domestic public. Domestic health financing is probably more subsidized by the citizens versus this public budgets that we look at. So it's the domestic public health financing. I think it's really important because now we look at it as health taxes have increased. So someone will complain that now I have to pay more. We need to shift that reframing in terms of, okay, industry is now paying a bit these goods, maybe that to local manufacturing of something health at a lower cost. Let's reframe that instead of looking at my now out-of-pocket cost for whether it's wine or a Fanta, especially on the continent.
Yeah.
Oops. So that's just one of the first things that came to mind and when you were mentioning too in terms of reframing it. So reframing it that way, how do we build trust? I think sometimes, it's breaking down the policies that we have. Like you said, you can use the litigation of these trips, these are my rights, these are my whatnot, but building trust with the community is really, like you said, first focusing on the health benefits, right? What are we trying to achieve? And understanding now, especially on the continent, NCDs, like you said, it's a bigger killer than infectious diseases. So we have the programs that work, that have been working for malaria, HIV, and now it's, okay, how do we as individuals have these conversations of, you're now stressed, so you're gonna turn towards this. This leads to hypertension. We don't talk about these things. These are sometimes taboo subjects for the everyday person, right? Your mental health might lead you to then consume that. So how do we, in terms of sensitization, have these conversations to say your behaviors are now shifting because you're going through these pressures. We don't really link them. There's always like an isolation. So maybe reframing it in that way so we understand, okay, when you're stressed and mentally going through this, instead of turning to these illicit substances, this is how we address them. So I think that's one thing, but also really ensuring that the burden's not on the average person. It is the public, the public sector, to ensure that their population is healthy. Yeah.
Okay, thank you for that. And Lizzie, just to hear also your perspective, how do we engage communities, consumers, so that any potential misinformation around the use of health taxes is not seen as just punitive, but is actually protective of public health? Thank you. Did you go to microphone? Okay, maybe we'll hear from you, John.
Thank you. I want to contribute to the earlier discussion, but also to your question. How do you first engage consumers? I think engaging consumers is a big agenda that starts right from our education system all the way to parenting, to people in different settings. But I would want to recommend what would be a whole of sector approach that looks at engaging different actors in a different way. I think we are used to collaboration in a performance way other than from an input perspective. So engaging stakeholders, for example, in terms of domestic resource mobilization, and in this case, discussion about taxes. How do you bring government, industry, and academia together, and on a continuous basis, have them discuss and deliberate on issues to do with, for example, domestic resource mobilization, what we call the triple helix model, that looks at engaging stakeholders. For example, academia. Academia has a lot to offer in terms of research and development, in terms of generation of evidence, in terms of social behavior change. So there's a lot that they can bring on board. Government interest is very clear. You want to increase revenue. You want economic growth for your country. You also, health is a public, good that you need to assure your population. So then the industry. I think the biggest undoing that we do as policymakers is engaging industry at the last point, when we want them to do a bit of public participation. We've already done everything, the groundwork, but then you're inviting them at the public participation. When I worked with the private sector, the need is engage me from the word go, while you're developing evidence, where you're setting long-term agendas. For example, Kenya Vision 2030, we are on the last stages. Kenya is going into Kenya at 2023. Kenya Vision 2023 or Kenya at 100. How do these contribution get into the table for discussion at that point so that we stop becoming reactional? So my selling point is a triple helix model that looks at who in government, who in the industry, who in academia and their stakeholders, and how do we develop a platform that sets a pace for not just now. We are looking at generating more tax, more revenue for now, but I think Edwin said we're also anticipating the next phase of pandemics, the next phase of NCDs, the next phase of no funding at all, the next phase of diseases. So how do we prepare ourselves? And I think that triple helix model is really a good model, but then who hosts this platform is a subject for discussion, because we need to build it from ground zero. And someone said, you need to grow a tree that you'll never enjoy the shade for. We're also building for our next generations. So that's a selling point. And the Africa Center for Global Health Security that's a mandate. Or that's what they're progressing in terms of engagement, not just for today, but also for tomorrow. Thank you.
Thank you very much for that. I don't think I quite caught your name and the organization you work for.
My name is Jane Gugi,
Okay,
I'm a health economist.
Okay, perfect. Thank you very much. And Lizzie, if you mind just building on that, the question that was asked about engaging communities, consumers on the importance and the use of these health taxes. Thank you.
Sure. I think one thing that people need to understand is if there's some sort of a gap, CSOs are the people to go to. And it's not only because we have the numbers or we know how to make noise, it's because over the years we've understood how the government and the private sector works. And I wanted to ask Ndili while she was that when, at the beginning when USAID was stopped, we were of the opinion that the private sector is going to fill that gap, and we started lobbying from that angle. And we were like, okay, we have the private sector, they have enough money, they've always wanted to support the health system. Why don't we look at them and ask for, of course we'll play with the figures, there'll be an ROI, etc. But then all of a sudden, I'm telling you, overnight, we're talking about MOUs that even civil societies have never seen, right? So for us as civil society, what we've come to understand is, especially private sector, and most people in the room complicate things that really are very simple to communities. And the way he mentioned it, if it matters to the person, the last citizen in the country, it's going to matter to the national government. And that's how even the Gen Zs in Tanzania now are working, right? And that's how the Gen Zs in Kenya have been doing it. We have to make sure that this information that we're talking about, syntax, 75%, 4.1 for Kenya, etc., make it in such a way that communities understand. And the minute we realize that this, at the end of it, is going to benefit our generation and the future generation, the way she's put it, we're going to come out swinging. And that's what governments don't like about CSOs. The minute we understand it and the minute we know that it's part of your agenda. Like the Abuja Declaration, 15% is 15%. You signed the document unless you were blind at that time. 15% is 15%. Get to 15% of the budget and move it to the health. Very simple. And we're using such kind of evidences to wake up everybody else. And we're saying, and we're putting that kind of pressure. And I'm going to say that openly. We're also just waiting for that committee to be set up for the MOUs that they're signing, and we're going back to making noise. We've been accused of working in silos now. We have the numbers. We know how to pressure governments, but we want you to also ensure that you do not complicate things that are very simple. If it's syntax, we go after the tobacco or the cigarette guy, we're more than happy to do it. But let us know, how does this benefit the community and every citizen in a country? Yeah.
Thank you for that, and I think you've raised the issue of the MOUs quite a few times, and I think is the real that we're all facing. We'll answer that question. So it's about our governments actually working together. Those MOUs are coming, but how do African governments work together to share best practices and learning through MOUs? But this is segue, another discussion. I was saying that I want to end with Edwin, but I saw Joy had her hand up, so maybe Joy can speak quickly, and then we just close with Edwin so that we don't keep you. So Joy, what was quickly your intervention, and then we just end with Edwin really on that point about consumers and communities. Thank you.
Okay, thank you. Just to quickly say something about consumer awareness and the acceptability. When we talked about incentivizing the reformulation, where in Nigeria they're working about front of pack labeling, and because for every product there is a label. But, where you have breakdown of the ingredients and their compositions. But beyond that, we're working on having front of pack labeling that has some kind of symbols.
The traffic light system was used in the UK, which basically tells you red is not good, green is good. So maybe what we're talking about, front of pack labeling, because that's been very loose in Nigeria.
So, with this, like, if you have sweeten the sugar beverage that has high content, that is being taxed high, and which eventually is being transferred to the final cost of that product, and a consumer that actually likes sugary things sees the sign, and also the price is higher than that of the lower sugar. These are two factors that at least it will come to his mind that, wow, with this symbol, this is dangerous, and also it is higher in price. So you just have to adjust your taste to go for the lower one and the safer one.
Thank you very much. And I agree with that. Front of pack labeling is very loose, we know, in our country.
I'll stand just because I'm short and people might be craning their necks. I think one thing we should not lose in the room is the cost is always higher. If I take, for example, the cost of tobacco on society will be always be higher than the revenue. Like that's, and if you run the math, like the very quick math, if about 10% of people who smoke long term get lung cancer, how much revenue do you collect from 100 people? Right? And what's the cost of treating that those 10 people? That math will never be equal. It will always be higher. So the cost on society, the cost in our populations for tobacco to be smoked by anyone will always be higher than the revenue and higher than the taxes that we will gather, right? So we just have to recognize as a base. So none of this is about taxes solving the problem by themselves. This is about taxes helping to solve that problem because we have a major revenue gap in how we finance our health. We have a major strategic gap in that if we're not financing the health ourselves or recognizing the truth that we largely finance our health, we abrogate to other people who are not from our places, exactly what Boniface was saying, who don't understand the healthcare system, the African healthcare system we need to build. Because they will come with, quote unquote, a bigger check, and they will convince you, or it will be easy for you to say, yes, that's the program we should run, because it's paid for, versus doing the hard work of building the healthcare ecosystem we need. So the cost will always be higher, and the people who will come to us asking and providing resources, and don't get me wrong, I'm not saying they're bad people, and I'm not saying that that is money we should say no to, but we should say yes to that money because it helps us build the healthcare system we need. We need to take responsibility and take leadership versus followership. So taxes reduces the number of people who hopefully smoke and use alcohol and the other. Tobacco is the easiest one, right? Because tobacco is easily a bad thing, right? So taxes, they reduce consumption and they generate revenue. When I said this is a 70-year journey, I meant it from the point of when people started saying tobacco is bad for human beings, was in the 1950s. Since the 1950s till now, we haven't solved the problem of something that now science categorically says this is bad for us. We've heard the industry arguments, exactly as Michael said. Those 7 arguments are consistently what the tobacco industry did. Oh, it's not so bad. It's actually not bad. Actually, you look very cool. Right? And then you go through those 7 arguments consistently. So every time you have an industry that is that's bad, quote unquote, you will find exactly this playbook. Which leads me to the point where I hope all of us leave this room with, is none of this can be but, it has to be and. Right? We need to raise taxes. And we need to fix illicit flows of these products into our markets. And we need to do public education to reduce young people from taking it. And we need to be observant of the new forms of these products coming to our markets. You know, this is the classic tobacco in cigarettes versus tobacco in vapes. It has to be and, because the minute you say but, it means that you're waiting for somebody else to do their job, yet you can actually do something now. Because again, remember what I said at the beginning, your Overton window for massive change in policy comes once every 10 years. Every country is in a different place on whether the window for doing massive taxes on sin taxes, every country is in a slightly different window. Some might be present now, some will be opening in 5 years, some it's going to take another 10, 15 years before we get there. But we have to do the incremental work now of changing other places that we have control so that we are also ready for when that Overton window happens, we're super ready to be able to squeeze these products out of our ecosystems. Because remember, it is always higher than any single shilling that we raise through taxes.
Thank you very much, Edwin, and thank you very much for everybody that contributed to this discussion. I think one of the overarching realities is, yes, we talk about domestic resources, we talk about ODA falling. We talk about still being dependent on aid. I think the message is without our government building the health system, even if we are accepting aid still, we have to set the priorities for how that aid is used as opposed to others telling us this is how you should develop your health sector. But I think we have to be in the driving seat of how we prioritize the health system that underpins all these issues that will be addressed, NCDs, communicable diseases, all of it. So thank you, everybody. Mercy will round up with a communique and next action points. We know this discussion is not just going to stay in this room. We hope to take it forward. So thank you very much, everybody. Over to you, Mercy.
Thank you very much, Vivian. Let's appreciate Vivian and yourselves for contributing. I don't think there's anyone who hasn't spoken. Otherwise, I'll give them the microphone by force. We have media in the room. I was expecting some questions from our colleagues from media. Anyone with a burning question or something they didn't understand or something that they think can be reiterated? Or is everything okay? Or do you want to talk to our participants later on during the networking lunch? The media corner, anyone with a question? I want to give media this opportunity. Being a media person myself, it's important that the folks from media say something. It's also okay not to have a question and want to ask later on. Oops, sorry. Anyone, is there somebody want to speak? Excellent. And also Pam. Okay. Let me give the journalist at the back and then I'll come to you. Okay. So as, of course, the name says it, Willow Health Media, we're media, so we are very deliberate about colleagues in media being in these conversations, not necessarily to even do a story from it, but some of these things are really complex, even for some of us who are here. So it's usually important for them to just come and listen, know who in the room is the right expert, because I am a strong believer that, media as the bit that sets the agenda for any country needs to be well informed. They need to know who the right persons are, because the quality of media really translates to the quality of conversations that we have as communities or as audiences. Kindly, your name and media house, and if you have any question or comment.
Thank you so much, Dr. Mercy Korir. It's good to be back at one of your very fantastic events. My name is Kevin Githoko. I'm a journalist by profession, and specifically I work with Migrant Narratives Africa, which is a digital publication that does, is specifically niche-based with migration, but also we tend to look at other, factors around, that very broad. Of course, health is inevitable. So I had a few questions for the person from going to Asante. So I was saying I have a few questions from the person from KRA, but I'm going to maybe request a sideline interview because I wanted to understand the concept of, somebody talked about the illicit cross-border trade and how sometimes it affects health financing. So I just wanted to get the proper background around taxation. So it's going to be some few questions, so I'm not going to ask them here, but I'm just pitching in advance so that when I approach. Yeah, but anyways, thank you. I sincerely appreciate, and also I'm sure my colleagues are very happy to always just come and even not necessarily cover. Of course, we are covering, but necessarily that, but also to be in a space where we can sort of pick the minds of experts, like you rightly put it. Asante.
Thank you very much. Anyone from the media corner? Anyone from the media corner? Online from media. Okay. Oh, okay.
Questions and whether people can address it just very quickly. Maybe it can be taken as one. So she had two questions specifically. The first one was, how will Nigeria ensure that revenue generated from sin taxes are transparently used to improve health outcomes,
especially in areas like NCDs? I think we've covered this a bit, but maybe that's a question. And the second question is, what specific data or evidence will guide the redesign of Nigeria's sin tax framework to ensure it protects public health without negatively impacting small retailers and low-income communities? So would anybody like to quickly take those two questions?
It's very Nigeria specific.
Yes. Maybe we can ask this question to the Controller General of Customs, because I think a big part of the taxes is the collection of it. So how can we ensure that the money is transparently used to improve health outcomes? Maybe you can take that question. Thank you, sir.
I'm not a Controller General. You said Controller General. I have to correct that impression. Except if you want to appoint me here as Controller General of Customs. There's no vacancy there for now. Well, when revenues are generated on the part of the Nigerian Customs Service, it is transparently generated, and we always account for them, because when they are generated, they go to the Federation account directly. How it is being applied becomes an issue for the government. And I think the Federal Minister of Finance is doing his best in that directive, because when it is assembled in the fund, the federal government fund, they meet with the states, and it is applied accordingly, and each organization, each at government level has its own share. So it translates to you that get it, how you applied it. So I think they are trying in this directive. And there are many agencies that check how it is being applied. Recently, we had Mr. Taiwo when he was talking about the various reforms they were doing, because they are not only stopping there, because they also go a step further to see how it is being applied. And incidentally, the present regime we have in the present of Chief Tinubu, GCFRN, is trying his best, because he came from the private sector where he had a lot of experience. He has been governor. He has worked in the oil industries before he even became a governor. So he knows how to apply all these things. So for now, it is not a problem. The government is trying its best. But it's a situation whereby people will never be satisfied. No matter what you do, people will always raise issues. There are people who specializes in not accepting whatever government is doing. And that is one aspect we are contending with. But be that as it may, I think the government is trying its best and is applying it adequately. And the one other challenge in this area is, recently you'll be hearing about the insecurity in Nigeria. We cannot pretend that it does not exist. So no matter what government does, it looks as if it is not doing anything. Even the recent comment of Trump, we are all aware how it has brought a lot of controversy in the government sector and generally in the country. But to specifically say it is trying in this regard. Thank you.
Thank you very much. Mercy, over to you.
All right. Thank you. Pamela Sitoni is, it's right to call veteran journalist in Kenya, but she's also my board committee chair for our editorial committee. So that's why she graced this event, and she'd like to say something.
So because you asked for media to speak, and I thought I should speak on behalf of the media, but really it's been wonderful to be in the room and to listen to this very, very important conversation. So I don't have a question. I'm really looking forward to when we get out of the room and what happens next. And for the Willow team that's in the room, I'm really looking forward to how we translate all this knowledge that we've received today into public information that then starts the conversation with the public and with the policymakers. Thank you.
Thank you very much, Pam. Very concise. Thank you, everyone. I hope we've not left anyone out. If you have something burning, this is all your opportunity. Otherwise, all the other conversations we'll have during the networking lunch. But this has really been a great conversation, a great event. When Vivian and I got lost in New York and we were thinking what to do, because we had online webinar, the aid dependency following the Trump orders. We started a conversation, but we thought, there's a lot more to discuss. There's a lot more that we can challenge, people like you and our audiences to start, having these conversations about that autonomy when it comes to not relying on the Western world to finance our healthcare. And even when you look at it, you look at the Lusaka agenda, it's called the Lusaka agenda. Yeah, and we've been getting finances in health, but it's been very, vertical, programmatic. So at the end of the day, there's a lot of money, but there's not really much progress and, not much development in terms of, health infrastructure, the health systems. So this conversation for us is to start us to think, well, we've started with the health taxes, but the conversation is to move also to what are the other pain points, the issues of efficiency that we talked about in the morning. We have all of this money that is coming in, but it's getting lost in many things. The other day when we looked at Gavi's audited accounts for Kenya, you find that they spent money on fueling motor vehicles, workshops, things like that, and very little money is going to the vaccinations or to the people who need vaccines. So that's efficient. So there's money there, but there's a lot of wastage. So this conversation, yes, it's about money, but we hope to take it beyond the money issue to more about having health systems that work for us, that serve our priorities. The conversations that have been here have really spoken about the non-communicable disease, let me call it pandemic, that's coming to Africa, because we've been able to address infectious disease. We are managing it in one way or another, but we're seeing this rising issue of non-communicable diseases. So how do we make sure that we are better prepared for it? And the speakers here have really spoken about it. And tobacco, alcohol, sugary items is one of those, or some of the key issues that we know definitely contribute to non-communicable diseases. So in terms of what we have discussed today, we've seen that and I think it's Edwin who presented in terms of what foreign remittances come into each of the countries, Nigeria, Ghana, Kenya. People have been funding their own healthcare in one way or another. So how do you consolidate this so that my 1 shilling, Palm's 1 shilling, somebody else's naira contributes to the overall pot so that we get a lot from it? So I think that has really come from these conversations. 2 is that donors have easily been funding infectious diseases for obvious reasons. And when you look at the history of even migration itself, when they screen you for TB, HIV, blah, 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 it's just because people don't want, as I think Michael said, they don't want the dust from your end to come into my side. So they screen you. So if you have any iota of TB, you stay out. But for non-communicable diseases, it looks like we have to do it ourselves. So the sin taxes then and the conversations we've had here should therefore be used efficiently, 1, earmarking, and that is one of the conversations or one of the key words that has come out of the conversation, earmark, 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 and ring fence that for non-communicable diseases and particularly for prevention. We tend to rely a lot more on, curative, which is costly at the end of the day. So how do we then earmark, ring fence those funds for preventive care? So that was, I think, one of the key things that we've picked from the conversation here. The sin taxes, we've talked really about tobacco, alcohol, sugary beverages. Betting and gambling, particularly in Kenya, is one of those big problems, and there's room to pick that, particularly for mental health, which is another NCD. So beyond hiking or raising the revenue or the taxes in what we know already is to widen that net of where we can get this money from. But at the end of the day, it has to be practical, and then it has to be used and ring-fenced for the non-communicable diseases or the health issues. Otherwise, if it goes to the federal port, if it goes to the national port, then we know how our politicians think. If you put a road, you're likely to come back, but if you're saying you're funding behavior change campaign, then people wonder, what is it? Because they can't see something tangible. So it's up to us in this room to make sure that those funds, and we've said that is the quick win, are earmarked and ring-fenced for health as a quick win. And then the next thing is, now can we widen the net where these funds are coming from? Then Hawea had talked about this. This reminded me of my economics class, the Laffer curve, Keynesian models and things like that. But the key thing was, there has to be political alignment to the tax morale. There also has to be alignment with the industry and the lobby groups, the illicit trade. As in, there has to be a balance, because you can only raise so much before it becomes, zero-sum game. So there has to be that balance when designing where the health taxes, the sin taxes are coming from. And then using data for resource mobilization. We are in an era where data is all over. So we just need to analyze and synthesize that data into content that now can be practical and content that can be used properly, because it's backed by evidence. And whatever you get from that data, the money that you can justify from that then can be allocated to mitigate some of the health risks that we've talked about during this conversation. And this is SDG number 17, partly why we are here. That's multi-sectoral partnerships, coordination, collaboration, it's key. Somebody talked about, if the trade industry is doing something else, health industry is doing something else, finance industry is doing something else, the CSOs are doing something else, and they're not talking to each other, then you may find somebody is negating what the other person is doing. So there has to be that multi-sectoral collaboration, coordination, to make sure that if we are saying the goal is for health, then we are all in the right direction. And Dr. Sultani said, the goal is health, the taxes is a side effect. So if that is the agreement and looks like that is what generally is a conversation here, then everyone has to be in that same boat. Otherwise, you'll find somebody else is negating what the other person is doing. And then last but not least, and this was the leaking bucket, the success of everything that we've talked about here will only happen if, one, there's transparency and accountability to build, credible systems. So if you have leaking buckets everywhere, then we will talk about all of these things. The money will come and it will disappear everywhere else. And well, 70 years from now, I don't think most of us will be here. But the people who will be here 70 years from now will still be having the same conversation. So it's really key then that we think about how to make sure that there is transparency and accountability so that we know where every shilling goes. So that if the money from tobacco or alcohol is earmarked for diabetes, for example, then we should see it directly going into that and not into some hazy and unaccountable bits. So that's really it from the conversations. I hope I did not leave any key point out. But we continue having this conversation. It's not the end. We need to move it into the next step where it really goes into policy, it really goes into legislation, because if it's not grounded in those spaces, then we'll just continue having very lofty conversations, intellectual discussions, and it doesn't translate into real life impact. So the challenge to Nigeria, to Ghana, to Kenya is to take this conversation to the next step so that in another year or 6 months when we are revisiting, then we make sure that we have seen some movement. We know how our governments move, but we have to try and do something. With that, I want to thank each and every one of you for making the time to sit here from 9 a.m., some of you 10 a.m., and to contribute to these discussions. I know some people had to come in and drop out, but really your input into these conversations have made it a success. In my community, they say if you host a party and people don't come, it's not a party. So we've hosted a discussion. If you hadn't come, then it should have been probably Vivian and I exchanging, our ideas and then, saying we've had a conversation, but you have made it to what it is. And we are really glad that you had the time, and I know the next time we call you, you will all come and we'll continue this conversation. So thank you very much. A special thank you to Nigeria Health Watch. Vivian and your team, you've always, showed up when we need you. You've helped us put this together. And without your team, we wouldn't have had this and have a successful, it's our first physical event and we've had a successful one. Thank you to Edwin and team, Aksam and Afia, for doing, that presentation. When we're thinking about who can map out what's happening globally, who's happening in Africa, Edwin and team were really quick to come in and do that presentation. So we thank you for being very valuable partners for our this conversation. We wouldn't have had it if you hadn't given your time, input to be able to get that content. Sampi Media, these are the people, kwa Kiswahili tunasema fundi wa mitambo, the people behind the cameras. If in case you look at the photos later and you're not looking the way you wanted, you can just ask them. But I'm sure they've made all of us look good. Thank you very much, and for streaming and making sure that the people online have also been part of this conversation. So I want to thank you very much. Fairview for hosting us. They've always been, ready to host us when we have all our events as Willow Health Media, so we thank them. Then last but not least, of course, is my team, Willow Health Media. I know they stand out, but I'll just ask them to stand. The team, Willow Health Media team, quickly stand up. Thank you for making this a success. I usually say I'm a very lucky CEO. I just give instructions of what needs to be done, then I find that they have done it. How they do it, they know their own ways, so I'm really lucky. Riziki, I'm sure all of you at one point or another have interacted with Riziki. Riziki Shah is our operations manager. She's really the boss of everyone. She makes sure everything works. And without her, we wouldn't have had all of this. So thank you very much, Riziki, for going over and above to make sure that this event has been a success. Then very last but not least, when we were putting this together, I had a conversation with Ben Agina. Ben Agina, I think, was the last person to come in. He's here. You can just raise your hand. Ben came here because we were putting this together, and on the other hand, they're having a discussion this Friday at Agile Hotel. APHRC and the National Assembly have brought in together few stakeholders, including the National Assembly in Kenya, for the development of a harmonized framework to support disclosure of sugar content on sugary beverages, confectionaries, and consumables. So it's another very important conversation, to be part of. Ben, I have invited everyone here on your behalf. They can come and contribute to the conversation here because we are all aligned, and hopefully we can, put all of these minds together because it's really a critical conversation. We are thinking about domestic resource mobilization. So thank you. With that, I don't think I've forgotten anyone. Oh, our online people. We haven't forgotten you. Thank you for your patience. Throughout this. It's not always easy to sit in this conversation online. Everyone who has joined us on YouTube, everyone who's been part of the conversation on Twitter, Beyond Aid Dependency, and on any other social media platforms, we thank you because your presence, your contribution, just that retweeting or posting, anything about this conversation has been really good and has made it a great success. Yes. So thank you very much. So from here, advisors. I think we can just put it here on the screen nicely so that you can give us your feedback. Moses, I think you can put it in the screen. We'll leave it in the screen so that scan, give us feedback. Like the next event, the next conversation to be shaped or to look like, so that, you know, we continue having these conversations, and our ambition is to move it beyond Kenya and Nigeria to just, you know, across the continent, because it's everything that affects all of us across the continent. So we'll call on you. So whichever country we'll be going to next, we'll call on you to be part of this conversation. Thank you very much. Now you can clap for me.
Thank you so much. We'll have a brief photo session. There are refreshments, but lunch is also ready downstairs. So you'll just pick meal cards from us as you head for your lunch. Thank you so much and have a good afternoon. The photo session will be here. So if you don't mind, you can just take photos with us for memory.
Stop taking meeting notes and let ClickUp AI Note Taker do it.